someone and having a conversation with someone here in Norfolk. The next thing you know, you're collaborating with them on a project or activity.
The amount of people within our community that support our business is outstanding because it's a give and take relationship. If you support everyone else, they will support you, and it makes our community that much stronger and that much better.
You know, I think that working with the local businesses here, everyone's very welcoming. Every time I meet a new business owner, and I love to go to new stores and new restaurants that open up and introduce ourselves and welcome them to the community. It's easy to fall in love with Norfolk County.
My advice to a family that's thinking about moving here is to come and visit. Come and spend a week. Come and experience everything that we have to offer, because you're going to find an amazing quality of life.
You're 10 minutes away from a beach. You're 5 minutes away from a dog.
I really hope not. It's up to him. Trust me, I have enough excitement in my own council meetings. I don't need to add more. I didn't see the agenda. Is there anything exciting on it? Either that or
Dog park, you know, there's so much opportunity in an area like this for young entrepreneurs, young families, even, you know, senior entrepreneurs that are doing that as well.
I'm very happy, I'm lucky, you know, very lucky I can be here, you know. It's a good place to raise family too.
We don't have this sort of slick veneer over us. We're really comfortable in our own skin, and artists are making art because they love to make art, and musicians are writing songs because they love to write songs.
And just because you're not from here doesn't mean that you can't embrace what makes Norfolk great. You know, sort of our diversity, our wonderful, the wonderful landscapes here.
We can hear you. Yeah.
It's just a great area. You're going to meet great people. You're going to have a supportive environment. We can compete on an international stage with anybody. And that's how we have to start looking at the world.
You just have to be willing to work hard, realize the potential that there is here, and just, you know, put yourself to work and create that opportunity for yourself.
I found that as a young entrepreneur, I was given every opportunity I could want. Just put yourself out there. Go to local events, and you're going to bump into all kinds of people that are going to be, you know, important business connections to you.
Everybody's so willing to help somebody else out. I think that's the best thing about even being a business owner in Norfolk County.
We're a small community, but there's so much support here, whether it's a restaurant or ecotourism. We just have this appetite, and if you've got a great idea, you've got a willing community that's going to get behind your idea.
You know, some of the advice that I would give entrepreneurs coming to Norfolk County would be to think outside of the Norfolk box, but don't forget what's in the Norfolk box, because we have a lot to offer. We have a lot of great people, a lot of great opportunities.
Norfolk County.
Entrepreneurs grow here.
Norfolk County.
Ideas grow here.
Norfolk County.
You grow here.
You grow here.
You grow here.
All right, so good afternoon, everyone. Welcome, I guess, to our, it'll be our second meeting now with the virtual technology. Just before we get going, I would ask that you please put your phone on silent mode, and big welcome to all of those that are viewing the meeting either on our web stream or on Eastlink. I don't need to tell anyone that the last 5 weeks or so have been incredibly tough for Canadians, Ontarians, and certainly residents of Haldimand and Norfolk County. COVID-19 represents a public health emergency that is unprecedented in our lifetimes and has turned our normal way of life upside down. And just when we get some tentative signs that we may be turning the corner on the virus, tragedy strikes in the form of the worst mass shooting in Canadian history, an event that I think many of us are still struggling to process, especially during what is already such a difficult period in our collective history. COVID-19 has affected every single one of us in some way and has unfortunately claimed the lives of 30 Haldimand and Norfolk residents. My heart goes out to all of those who are missing their loved ones at this time. And yet, amidst all of this, the pandemic has also shown us just how strong and resilient our community is. We've seen healthcare workers working double shifts to care for the most vulnerable, families banding together to make sure older relatives get their groceries, parents juggling full-time jobs, keeping their kids educated and active, businesses rapidly adopting new strategies to keep serving customers, and local organizations who, when asked if they could help us build life-saving ventilators in the case of a surge of COVID-19 cases, immediately got to work and built us more than 50 in a matter of mere weeks. We've also seen waves of volunteers come forward to help our community in any way they can, and that includes a list of more than 500 people who have registered with Haldimand and Norfolk counties, making themselves available for a range of tasks should they be needed. So while we aren't out of the woods yet, sometimes I think it takes a crisis to show us who we really are, and we should all be proud of this fantastic community that we call home. So with that, I also would like to start out and say another thank you to Ryan Wallace, who's here helping to film the meeting for today. We are going to begin today's council meeting actually with a Board of Health meeting. But before we do, I'd just like to touch on a minor procedural error, or matter rather. We do have a lot of committee reports and correspondence on today's agenda. So if council is comfortable, I'm proposing that we would exclude these from the formal recorded votes, which we had decided to adopt with this technology. So does that work for everyone? Okay. So unless there's any objections, we will just simply raise our hand to vote on those two sections of the agenda, and we will reserve the recorded voting for staff reports, motions, and bylaws. I'm also happy to welcome Mayor Hewitt here today to participate in our Board of Health meeting. He will be a non-voting member, and hopefully we might see him back for others as this crisis continues. So with that, I'll call the Board of Health meeting to order. And are there any changes to the agenda? Okay, seeing none, if I could have a motion to approve the agenda as presented. Councillor Rabbits and seconded by Councillor Martin. All those in favor? And that's carried. Don't forget to put your hand up there, Councillor Van Passen. I can't see him. Is he okay there, Brent?
He
Okay, any disclosures of pecuniary interest? Okay, seeing none, we'll proceed. The minutes of February 4th are before you. Are there any errors or omissions? Seeing none, they'll be declared approved. And first up, we're going to have a presentation from our Medical Officer of Health, Dr. Nisa Thari, and then we'll follow up with some questions from the board at that time. Shankar, I'll turn it over to you.
At the onset, I'll learn how to put the microphone on. At the onset, I want to thank Madam Chair, members of the Board of Health, Mayor Hewitt. Thank you for allowing me to present the perspective of the Public Health Service. I'll be a bit more long-winded today than my normal brief dialogue, but I want to share with you the response of the Public Health Unit towards COVID-19. So rarely would I be so bold as to say this meeting is about saving lives. In Haldimand and Norfolk County, we've been really quite significantly impacted by COVID-19. A key part of the public health service is mitigating and managing risk, and that will pervade through this entire dialogue today. We'll do our very best to try to minimize risk and to mitigate risk in the community. And that works by identifying, managing, and mitigating. So, so when we think of public health management tools, when we think of putting a public health management plan together, there are many things to think about. There's education, dialogue, persuasion, regulation, media, and public health orders. And together, they form a public health management plan. The one thing I'd say before I get into the meat of this discussion today is that the Public Health Service is apolitical. You know, we're governed, and I'm governed by the Health Protection and Promotion Act, and it is by that authority that we act on behalf of the public. So what is the current status of COVID-19 in Haldimand and Norfolk County? Well, I'll just present the snapshot, and then I'll share some more details. There have been 30 deaths in Haldimand and Norfolk County. To put that in perspective, we would expect maybe 20, 25 deaths from car crashes in any given year in Haldimand and Norfolk County. We would expect probably less suicides. So when we think in this past month we've lost 30 people, it's a significant challenge to the community. There are 185 identified cases, and my guess is for every case there are many, many people who are infected, maybe 10 times as much. I share this illustration or this graph because this is a bar graph, and on the left side are the number of cases, and we have different dates and times. And the orange shows something that's very striking. If you look on March 13th is when we believe the first person actually got ill in this county, in both of our counties, but you will see a spike that came in somewhere between March 7th and March 10th. That's the first spike. And then there's a trough. And then there's a second spike. And then there's a trough. Now we're seeing the most recent data suggested there's an elevation again. We don't really know if that's going to be a third spike or it's going to flatten out. It's hard to know. And epidemics typically have waves. They come and they go. They come and they go. I'll show this slide again with a different set of data elements on it. But needless to say, 30 people have died from COVID-19. Some lived in the community prior to their death. Many lived in a long-term care home. The deaths have substantively been people in their 7th, 8th, and 9th decades of life. We have tested 1,200 people. When you think of it, we've tested basically 1% of the people who live in the health district. We have 185 positive tests, and as I mentioned before, there are many more people who are infected. And this, I think, is important. Anytime there's an epidemic, it's managing the people and managing the disease. And at the health unit, we've taken 4,500 calls. I'm really proud of that because many of those calls reassure people, they put it in perspective. But if there are 30,000 households in this district, we've directly reached probably more than 10% of them. That's a rough estimate. But one other thing I think it's important is the cases are widely distributed through the health district. This slide is important because it shows the age distribution of the positive cases. If you look on the very right-hand side, you will see that most of the positive cases are among the elderly. And that is what we might expect with COVID-19. This is a distribution of the cases in Norfolk County. Now, from my vantage point, I think of Haldimand and Norfolk as one health district. It's the way I've always thought about it. But I realize that people are always interested in what goes on in Haldimand County and what goes on in Norfolk County. So the minority of the cases are in Norfolk County, only about 15%. This is the data from Haldimand County. Now, the issue here is that the cluster, the group of people at Anson Place form a cluster, and they represent a disproportionate number of people in Haldimand County. I want to share with you that no one is, no group of people are protected from getting COVID-19. There was a positive case among the staff at the health unit. Now, the fact of the matter is we do deal with this all the time at the health unit, and once there was a positive case, we managed it like any other positive case. So I want to share that with you, that in any large employer or any institution, be that an employer or church, that COVID-19 could affect them. So what has Haldimand and Norfolk counties done? What has the health unit done to make a difference in COVID-19? Well, first of all, both in their separate capacities, the mayors of both counties have activated the called an emergency. We've activated the Emergency Operations Center. And the first and foremost goal is to contain, there's containment. Try to contain the disease. Second, if containment doesn't work, if you cannot control the number of people who have the illness, then try to build capacity at the hospital and other acute sites. Number three, early on in the pandemic, we thought that we might run out of ventilators. And if we don't have enough ventilators, we'd have to turn people away from treatment. So the emergency operations centers, the counties, and people in the district actually went to make some build things that might substitute for ventilators. And then I think we have to, and this is hard to think about, we're in the pandemic, but we also have to think of the process of returning to normalcy. There's a new normal in the immediate term, and then there's the long-term battle of, and for me as a parent, one of the things I think about is, how do I get my children back to school? They've been deprived not only of their liberty leaving the house, but how do we get control of this so that the children can go back to school and regain instruction? I put this slide in here because I want us to think about the primary way that people get COVID-19. They get it through respiratory droplets. Cough, cough, cough. Cough, cough, cough. Most people who get COVID-19 have mild to moderate illness. If a young person gets COVID-19, they're going to feel bad. They're going to be stuck at home. They're going to have a cough. They're going to have a fever. They'll have muscle aches. Some of them might have atypical symptoms, such as a nausea, but they'll get better. But if an elderly person gets COVID-19, the result could be catastrophic. I put this slide in here because this sort of tells us the challenge. If we take the top box, the population of people who live in Haldimand and Norfolk counties, there'll be a group of people that aren't infected. Those people who aren't infected, they won't harm anybody. But there's a small percentage of people that will be infected, and that's on the right side. And this is something we only know now, which is that there'll be some people who are symptomatic, and they will cough. And when they're symptomatic and cough, they will make someone else sick unless they're on isolation. But we also know there are a group of people that are asymptomatic. People who don't know they're sick and continue on with their life. And those people can also transmit COVID-19. So it's a serious challenge about how to control COVID-19. So what is the public health unit doing? Well, the first thing is containment. And containment is identify, test, isolate, and follow people's adherence. So it's to find the people who actually have COVID-19 and to test them. And once we test them, we can put them in self-isolation, and then we can monitor adherence. I want to talk a little bit about the chain of transmission. We hear this on TV, and we hear in other enterprises or in other media. Without revealing too much of the confidences, this is a real chain. This is a real chain. So congregate setting could be a daycare center, a nursing home, a prison, a retirement home. The chain goes from a healthcare worker to a child, to another child, to a healthcare worker, to another congregate setting, and get spread of the disease. So what we want to do is when we find someone who's a healthcare worker who's got testing positive, we want to try to break that chain. Here's another chain. Migrant worker travels through the Toronto airport to farm manager, to farm manager's wife, to child, to grandparent, to hospital, and ultimately someone succumbing to it. And the chains that we have the data. We now have data on Haldimand and Norfolk County. It's just not theoretical data. These chains are real. I would say that the airport would be the metaphor and not the migrant worker, but from the airport we can trace things like this. So we really are working to prevent COVID-19 in congregate settings. That's because people live in congregate settings are the particularly high-risk population. And I'm going to talk a little bit more about this, but containment among people that are older is a priority. It's a priority. It may not be well known that the vast majority of elderly people actually live in the community. And we've advised for many, many weeks on the Public Health Service that if you're over 70, stay at home, self-isolate, get your groceries delivered, have your children or your family bring you supplies. That's what I tell my mother, and she's 79. So that's called the ring fence strategy. But not everyone lives at home. Some people live in long-term care facilities. And in fact, across the province, there are 176 long-term care facilities and 55 hospitals on outbreak. So there are about 600 long-term care facilities in the province. So this is quite a significant number of places that are on outbreak. In our district, we have 3 places at outbreak. One of them where patients are affected, and 2, the containment is limited to the employees. So what do we do at a long-term care home or retirement home to prevent the spread of COVID-19? What do we do? Well, the first thing is that we have a team. We have a team that deals with nursing homes and retirement homes. The second thing is, if the place is not an outbreak, then there are certain things we always do. One is we screen people before they come into the institution. So if you're sick, you're excluded. Visitors are not allowed into nursing homes or retirement homes, with very few exceptions. If someone's at the end of their life, we would allow that exception. Otherwise, visitors and others are not allowed to attend. If there are healthcare workers who are coming, they're only allowed to come for selected circumstances. We've asked the doctors in the health district to work out of 1 or 2 institutions as opposed to traveling from institution to institution. Healthcare workers, like healthcare aides, personal support workers, we've asked them to work in one place. So, and then we've asked every healthcare worker who works in a long-term care home or retirement home to wear a mask. So cough, cough, cough. If the metaphor is cough, 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 wearing a mask might make a difference. Now what happens if we find a place that's actually in potential outbreak? Well, we step that up a bit. We ask every patient to stay in their room. We ask every resident to eat their meals in their room. The reason for that is we want to prevent transmission from a patient who might be sick to another patient who's sick. And then we ask every member of staff to wear a mask, gowns, face shields, and gloves when they treat patients. So there are multiple barriers to try to make sure that people that are elderly don't get sick. New arrivals or visitors are vectors for COVID-19 transmission. The risk of COVID-19 transmission is spread by in part by the number of new arrivals and the number of times that person travels in and out of the health district. That's just not theoretical. That's our experience here as well. I'm going to show you this slide. I wish I had a pointer to show it. This is the COVID-19 data for our health district. We have enough cases now. If you look, the first case we believe, and this is epidemiological assessment. It's always subject to review, but on March 13th was a travel-related case. And then a couple of days later, there were 3 travel-related cases. And then a couple of days later, there was another travel-related case. And then after that, there was another travel-related case. And after that, there were 2 travel-related cases. And if you follow that curve, you can see when we go to April 6th, we have 21 cases. And then it troughs again, and then we get a bump. So our data suggests, and I think the evidence suggests that we have, and it's public policy, which is to stay at home unless you have a good reason to leave the house. I put this in here because that is one of our core messages. Stay at home, stop COVID-19. So what are we doing? What are we actively doing at the health service, to try to effectuate that? Well, there are 4,500 agricultural workers who are joining the Haldimand in Norfolk County. The vast majority of the agricultural workers are going to actually come to Norfolk County and not to Haldimand County. And so we've required agricultural enterprises to have a self-isolation plan. The actual elements of the self-isolation plan are substantively what the government has already promulgated, but as an additional layer, we've asked people to articulate their self-isolation plan. And I thank the board chair for speaking boldly on that topic. We provide education, support, monitoring, and rare cases, occasions enforcement. When you take by capita, there's only one place in Ontario that has more migrant workers, and that's Windsor. They have 8,000. They have 5 times the population. We have 4,200. I have the data with me. So per capita, Norfolk County is an area at greater risk. And it's not a theoretical reality. There's an outbreak in Chatham. They're testing 250 people now. I spoke to the medical officer of health there yesterday. There's an outbreak in Windsor. There's an outbreak in British Columbia. There's an outbreak in a meat packing plant. When a place goes an outbreak, it's adverse to the people because they get sick and they suffer because they're sick. If they're in the self-isolation period, or they're going to be isolated for even longer periods of time, and if they're migrant workers, they're going to be away from their families and their home. The whole idea of being sick at any level, being away from your family, not a great thing. The farmers suffer because you can't have people work when you're on quarantine. That's the law. So they have to pay these people, and I'm sure many of the farmers are concerned about their staff. I'm sure the health. And consumers suffer because we don't have a food source. So if we can't manage outbreaks, we're going to have trouble in many different ways in our society. And if you have an outbreak in a large agricultural enterprise, it's likely to spread to the community as well, just by the nature of the interactions of an agricultural enterprise. People have asked me this many times, why does Haldimand and Norfolk require people to self-isolate in no more than groups of 3? Well, the first thing I would say is that if somebody came from Florida, or they came from another part of the world, or on a tourist, we would ask them to self-isolate individually. And I don't think Mrs. Chop would mind me saying she's self-isolated, right? So that's what we expect for everybody. And self-isolation means that you stay in your own area, use a separate bathroom, use a separate kitchen, stay away from the rest of your family. When my daughter and I are separated, she's in Puerto Rico. When she comes back, either I'm going to have to self-isolate from her, or she's going to have to self-isolate from me. Those are the rules. Or I'll move into a hotel. Whatever it is, those are the rules. And the reason we self-isolate is to prevent transmission of someone who newly arrived. We saw that graph before, and you can see that that's a real problem. It can be a wave, an epidemic, second wave. It's on our minds. So when you have one person self-isolating, they can't give the illness to anybody else. The risk is only for them, and that's the risk they got from their country of origin. I hate to bring up a bit of mathematical theory, but if you have 2 people self-isolating, not only do you have the risk that you would get, the person A, the fellow on the left, of getting sick, you also have the chance that the other guy might get sick, and that other guy might give you the illness. So you basically double the chances of self-isolation failing. So if you go from 1 to 2, you will double the chances of self-isolation failing. And if the self-isolation period fails, that means both of those individuals will have to spend a longer time in quarantine. If we put 3 people, then not only can the guy in the red get it from the guy in the blue, and the guy in the red could get it from the guy in the green, they could also have a chain. The green could give it to the blue, could give it to the red, or the blue could give it to the green and give it to the guy for the red. And now it's an exponential, to geometric growth. And every person that you add to a bunkhouse or to a self-isolation facility, you increase the chances of an outbreak. And if you increase the chances of an outbreak, you increase the self-isolation period, that means more people are in quarantine. And that's the reason we picked 3. That's the first reason. The second is purely a compassionate reason. It's one thing for me to self-isolate with my daughter. I've known her 21 years. If we have to self-isolate and we have to spend another 14 days together because one of us gets sick, it's not the end of the world. Self-isolating with 3 strangers, people that you've never met before, in a confined space. You never met with them. You got off the airplane and you met with them. That is not consistent with compassion. So as difficult as COVID-19 is, during the self-isolation period, and that is another reason why we elected 3. There's all sorts of literature on how people are adversely affected by quarantine and self-isolation. It's not easy. It's not easy. So that is the reason we chose 3. Is the health unit working to get these applications through? We are. The staff are working, 7 days a week. We have people working every day of the week for these past 6 weeks, and we've had people on mandatory overtime. I'm not an expert on the operations, but Marlene can comment. We've authorized 2,400 farm workers, and we work with the farm workers, with the owners of the agricultural enterprise to get the plans. And many of them have actually been quite wonderful. I remember getting a letter from the wife of a farmer. She asked me, I don't even know if I want to participate in this because I'm worried about my children. One of the things to think about is many farms have multi-generational families. And multi-generational families are at the biggest risk, where grandma and grandpa can get sick from COVID-19. So, what about other non-residents? We have migrant farm workers. The province has already closed campgrounds, trailer parks, recreational facilities, marinas. The Public Health Service and I wrote an order asking people that if their primary residence is not in Haldimand or Norfolk County, that they're required not to occupy their vacation homes. The reason for this is it's the traffic back and forth. And I don't speak to this many times publicly, but I think it has to be said. 60% of the cases in Ontario are in metropolitan Toronto. We are only 1 hour from 1.5, 2 hours from metropolitan Toronto. The people going to a vacation home back and forth, it's even, that is problematic. Secondly, it is consistent with public policy. The public policy is stay at home, stop COVID-19. And so, as difficult as this is, I think that is one more strategy. So they're dealing with agricultural workers, requiring self-isolation of new visitors, trying to reduce traffic as best we can. So just a few things, just a summary slide. We isolate and test. That is one of our strategies. If we think of Haldimand and Norfolk counties, we isolate and test. We have strategies to deal with seasonal residents and tourists. That includes closing restaurants and closing other draws. Migrant farm workers. We have public health actions and orders. And a good part of that is education. And for the few people that are recalcitrant, it is guidance and ultimately enforcement. So what are we going to do if containment's not successful? Up to this point, containment is held at Haldimand and Norfolk. It's not. I don't think it's because of anything that the Public Health Service has done. We'd like to think that, but I think in part it's our geography. I think that we've been okay for right now. So we have to, if in fact containment is not successful, then the next thing to think about is how can we plan for additional cases? And that's people with mild, moderate, and severe COVID-19. And we may have the potential to exhaust hospital capacity. Initially, at the beginning of the pandemic, we thought we might have 500 extra deaths. And so we had to think and plan for that. So this is an interim care facility. This is a facility that's in Port Dover. If we had no other place in the hospital to put somebody, the county, working with the hospital and the local doctors, could activate this facility. I know some Board of Health members came to visit that, it's one additional layer of insurance. There's also a facility in Dunnville. That facility helps support the hospital in Dunnville. What if we run out of ventilators? What are we going to do then? Well, from my vantage point, we don't have to. I don't think we. In a wealthy society, I think we should have enough ventilators. So, and I'll show you a few things. So, this is a Genesis ventilator. This was in the County of Norfolk stores. We didn't throw it out 15 years ago. The reason I use this balloon is I don't have a synthetic lung here with me. But this ventilator can keep you alive for many, many hours until you can find a more permanent ventilator. We have 15 of these. We have more ventilators in the health unit than are at the hospitals. So we have 15 of these. Secondly, and you can come look at this, we have a very basic device that allows you to bag somebody. So if someone is intubated, you know, they're getting short of breath, we put this tube, we put this tube like this in their throat, and we bag them. Well, this device, if you don't have a ventilator, can keep bagging you in an automated fashion for hours. And thirdly, a gentleman from Haldeman County, when he heard that we were having this struggle, he made 50 ventilators. He has an aerospace company. We're going to, Ms. Chop and I, and hopefully Mr. Hewitt, we'll all go and see those ventilators, and we'll have a video out on them. So I don't think we have to worry about ventilators. I actually think that we may need them for the next pandemic, but hopefully for not this one. Do we have the video on this one? Well, there we go. So this is a very sophisticated bagging device. It simulates a ventilator, and we'll have 50 of those, hopefully, in the county stores in the next couple of days. Can we go back to the slide deck? While we're waiting for the slide deck, I just want to show you some other things people in the county have made. 150 women in the district made masks. These are homemade masks. If we ran out of masks at the hospital and we had no other choice, we could use these homemade masks. And the homemade masks are pretty good for preventing you from giving the disease to somebody else. So if you're going to see your grandmother and you have no other choice, use a homemade mask if it's not going with one at all. I'd prefer you don't see them at all, but if you have to, the mask is at least some barrier. So, you know, as a doctor, one of the things is to always tell people the straight up answers. So should we be worried about a second wave of cases? Well, history would tell us that's what we have to worry about. It happened in the SARS pandemic, and it happened in the Spanish flu. And in the Spanish flu, more people died of the secondary wave than the first wave. And the risk factors are well known. There's increased travel. There's calling a pandemic over prematurely. There's mutation of the virus. There are lots of reasons why it could happen. This is real data. This is a real event. This is the SARS. And if you look on the left at the number of cases, and if you look as time progressed through March of that year, you see the spike. And I think March 27th is the spike. And then it went down. Just like us, it went down. And then they call the outbreak over, and then there's a whole group of cases. Some more people died. There was 17 people actually died on the second. And in retrospect, if we'd held the line, maybe those deaths could have been prevented, or some of them. So what can we learn from public health challenges? You know, the statute was written based on the history of this province, right? We know in SARS there were 475 cases, 44 deaths. We've already had 30, and that's across the province. We've already had 30 deaths in Haldeman and Norfolk counties. And in Walkerton, that was a water issue. I would say that we could have done better on the public health service. There were 2,000 cases and 7 deaths. And Walkerton is a little town. It's a little town. So when I think of this, whenever we think of a public health management plan, we think of a couple of things: the importance of the problem, the measures to quantify risk, the tools that are the tools that are available, not the tools that are disposable. Education, dialogue, policy, rules, law, public health orders. And as many of you know, I've written many orders under my statutory authority. But here's the thing. When we think of this is a difficult challenge. working together, Haldimand and Norfolk counties have prepared a robust response. There's no disputing that the counties have worked together, the people have worked together to find an appropriate response. I think the next thing is we have to think about how we return to normal. How do we get back to some part of our lives again? And when I look at the data and I think in reviewing the risks and benefits, I think one small step would be allowing access to trails. Now, I'm not an operations guy, and we have two excellent chief administrative officers for each county, and I've asked them to formulate a plan to effectuate that goal so long as, and my ask to them, and I know they would do this, is that we effectuate social distancing and don't increase the risk of any further transmission of COVID-19. So I would close with this. I lived, and I may say this way, I may have repeated this, I lived through the HIV crisis. I graduated medical, this is my 30th year of practice. I lived through HIV. Our culture lived through SARS. I lived through H1N1. My son was a presumptive diagnosis of H1N1. This won't be our first pandemic. I think there'll be others in the future. But I think that we should recognize that the plan is the same. We use every resource that's available to us to manage these public health challenges. I think we'll get through this pandemic like we'll get through other pandemics. We just got to stick together in our plan moving forward. So, Madam Chair, I'm sorry I took more than the 30 minutes I was allocated, but my apologies.
Did a fine job, Shanker. Thank you. Any questions from the board? Oh, Brent, sorry, can I? Councillor Huffman, Board Member Huffman.
Okay, so you can hear me okay? Okay. I just wanted to clarify a few things because obviously I've had a lot of constituents ask certain questions. So I just wanted to get some clarification if that would be okay. My first question is, employees, you stated in your report that they've been asked to work in one location. Have they been asked or have they been mandated to just work in one location?
So at long-term care facilities, I had a conference call with all the administrators many weeks ago, and it was more than an ask. I would use the term strong recommendation, and they're compliant at that time. Then the province passed a law that required it.
Okay.
If we didn't get compliance, I would have written an order to that effect. But the nursing home administrators, they're as worried as, when I speak to them, and we have a number of institutions on watch right now on outbreak assessment, that they were cooperative. So if in fact we weren't able to get compliance voluntarily, we would have ultimately drafted an order to that effect.
Okay, thank you. I just have two more questions. My next one is, obviously we're all aware that there's been some unease in the community in terms of the trails and those types of things being closed, and the issue with the migrant farm workers. And just wanting to clarify, do you make those decisions unilaterally, Dr. Nasathari, or are those done in conjunction with Mayor Chop and Mayor Hewitt, or how are those, if you could clarify for the public how those decisions are made?
So the statute requires me to make those decisions. I do have dialogue with Ms. Chop on a regular basis as board chair, as with other Board of Health members. They call about items that are of interest to them. But at the end of the day, those decisions, if I could add some additional commentary, whenever we think of a public health management plan, the first is always, do we have a legitimate goal? And then how can we effectuate that plan based on a number of factors, including how urgent is the problem, what's the level of risk. But at the end of the day, the inspectors and the service, as it relates to the delivery of programs and policy, are decisions that I make, and we weigh them carefully based on the context. Sometimes they're not easy decisions. It's like practicing medicine. They're not easy decisions. So I hope that answers your question, and depending on the level of severity, it might reflect how quickly we move. Because COVID-19 was life and death, we acted as assertively as we could early on. So with nursing homes and those kind of activities, we acted before, like putting on a mask. We did that a month ago. We reduced the number of, in our health district, we reduced the number of people congregating much faster than perhaps the provincial authorities. So I don't know, does that answer your question? I want to answer it clearly. I'm rambling a bit, I recognize that.
Yeah, I think that clarifies for individuals in the public. My last one is, my concern is, I haven't heard anything from the public regarding this. This is just my own piece, is that the last couple of days there have been, and I just wanted to clarify, I'm not sure, my apologies, I'm not sure if it's the wording of the media or if it's the wording from our local health unit, is that the term outbreak has been used, and it was used in regards to Parkview Meadows and Townsend, and it was also used in terms of Crescent Care and Cortland. And as it turned out, with the information that we have, I know Parkview Meadows was 2 staff members tested positive, but no residents. And the Crescent Care one, again, it was 1 staff member, no residents. So is the term outbreak the right terminology that we want to use in circumstances like that?
Yeah, no, your point is a very good one. So the academic point is that this was the first time in my professional career that I would call an outbreak where it doesn't involve a single patient. The term outbreak we had to use the term because it's governed by the provincial rule, and they redefined outbreak as 1 staff member. So that's why we use outbreak.
Really?
Now, in our press releases, we always state that the outbreak does not include, if in fact it doesn't include a single patient, we say that. And I think in both previous press releases we have. Your academic point is an excellent one, though. And your perspective would reflect what medicine has historically articulated, which is if there's no patients involved, I wouldn't articulate it as an outbreak. You may call it a cluster or some other epidemiological term.
Right, okay. All right, thank you very much, Dr. Necessari.
You're welcome.
Thanks. If I could just jump in there, actually, just to expand a little bit on Councillor Huffman. The one with the outbreak, I believe I had included that definition with the one update that I had provided, because that was the same situation that we experienced at Norview as well, and was just to give you guys a heads up that it makes it seem, perhaps more aggressive than it is at that moment. In that case, it was just 1 staff member. So,
yeah, and if I could add, Madam Chair, when we use the word outbreak in medicine, what you really mean is have heightened alertness or heightened awareness. That's why we use the word outbreak. And when, because COVID-19 can be so devastating to nursing home patients, the moment that we know that even if 1 staff member is affected, we institute a whole suite of extraordinary measures. And so I think that's the policy choice behind it, but it is not congruent with what we can classically think of as an outbreak in medicine.
okay, and if I could just want to expand a little bit, Shanker, just on Councillor Huffman's question there in terms of the authority to make decisions and so on. Perhaps you could clarify first, the Section 22 orders for board members are only related to contagious disease. It is a special power that you have in the case of a pandemic like this, and it's not that you ordinarily would be able to issue orders.
Yeah, as a general construct, I loathe restricting people's liberty. I really do not like writing orders, because I think that there are many times in public health we can achieve our goals through merely dialogue. And in fact, even in these difficult circumstances, when we can achieve many of our goals through dialogue, education, shaping. But the Section 22 power for infectious disease is broadly written for precisely these issues, is that how do you act assertively on matters where you could have things like pandemics or epidemics or items of real public health significance.
Okay, so then just to add a little bit more color to this then. So you've been given broad powers in the case of infectious or contagious disease to be able to issue orders under Section 22. The other part with the Health Protection and Promotion Act, and I'm raising this now because obviously, you know, there certainly has been pushback from, you know, the agricultural community and why they're, you know, why Shanker made the decision for 3, migrant workers to a bunkhouse. I think it's important to understand that, you know, Mayor Hewitt and I, although we speak with Shanker on a daily basis, that authority is his, like to the point of your question, Councillor Huffman, and his alone. And so we may not always agree with Shanker on everything, but at the end of the day, it's Shanker's decision. And also in the Health Protection and Promotion Act, it was very, I think it takes, the only option that you would have if board members disagreed with Shanker would be to have him removed. And under the Health Protection and Promotion Act, they have very clearly, you know, made that position apolitical to a certain degree, where it takes 2/3 of a vote by the board to remove your medical officer of health, so that decisions regarding public health are not made at the whim of politicians, which makes sense. And furthermore, even if you did have the vote from a board of health, you would still have to have that termination approved by the province, just as Shanker's appointment is approved by the province. So just to provide some additional clarity to that end.
Yeah, you know, that is the law. You know, when I took this job, I knew that the job is apolitical, and many of my activities are like being a judge. I do, and you know, the legislature, the people, decided this is the way that they wanted to organize the public health service. We're not the only jurisdiction, you know, that has very defined matters to protect public health officials from political, and I would never use the word whim, but some level of political pressure. It's the nature of what we have to do. In this particular case, you know, there's always soul searching. You know, when I drive home, there's always soul searching, like about what action, when to do it. My own children argue with me about certain of the things because they too have their perspective. But at the end of the day, we just have to make, and sometimes I have to give closure. It's you know, as a teacher, that's a hard thing to do, is to say, well, I know that you have your point, but, and I tell that to my kids. They're like, well, you got a great point, but I think at the end of the day, this is the best decision we can make. But thank you, Madam Chair, for clarifying what the statute is and what our responsibilities are related to that.
Thanks, Chair. Just so we're clear, I wasn't making any suggestion
it's,
there whatsoever.
No, as a, you know, if I could share, as a matter of how a democracy functions, the people get to vote for, from my vantage point, they get to vote for their elected officials, and they have to advocate for them. And then there's certain positions that are shielded from political influence, which is judges, medical officers of health, and so I think that's okay. I'm glad that you brought it up.
Councillor Martin. I saw your hand there.
Thank you, Mayor. Councillor or Board Member Huffman spoke on it. I wanted to specifically chat about migrant workers and outbreaks.
Board Member Kravitz.
Thank you, Madam Chair. Through you, can you hear me all right through my mask? Yes. My question was with regards to different jurisdictions and some of the questions that's been posed to myself and likely my colleagues is why do certain districts have certain provisions while others do not? And rather than speculate, I was hoping maybe you could comment on perhaps why medical officers of health in different municipalities are choosing different levels of restrictions to put in place. And I have some more questions, but I think I'd like just to start with that one because it's a difficult question for me to answer why an adjacent community would have different decisions being made. And a lot of this is flowing from provincial statute and law, which further complicates why we're not seeing a uniform response across municipalities in Ontario. And I just want to provide you an opportunity to maybe clarify how that can be and, you know, what maybe the specific circumstances are to Norfolk County that have influenced your decision making?
Sure, no, thank you for the question. Ontario has 34 autonomous health districts and 34 medical officers of health and 34 boards of health. And in part, I think the statute was designed to deal with the local realities or the local preferences. So we have some challenges which are sort of unique to other districts. We have per thousand or per capita, we have the largest number of migrant workers coming. So that's always a challenge. Secondly, we have a population of some people that have vulnerable health status. We have 4,000 Low German Mennonite residents in the western part of the health district. Many of those families are multi-generational and have otherwise, we work to try to provide public health services to them. We have 2 reserves adjacent to the health district, and that weighs on my decision making as well. And then, so those are sort of the local realities of this health district. And then there are things that are contextual. I'm very cautious. This is my 30th year of practice. I still think medicine is about saving a life. I think that most people would think that I practice medicine cautiously. If I think that we can do things to save lives, we would do them. And we did them before other people may have chosen to do them. And those are just individual level decisions we have to make. The other thing I'd share, and share this, not share this otherwise, as it relates to agricultural farm workers, other districts are using our guidance documents. They're using our strategies. And they've asked for them. They've asked for them. The difference, I think, between our district and others is that fundamentally I asked, not I personally, but the Public Health Service asked affirmatively for people to state what is the self-isolation plan for these congregate living situations, because we saw this as a high-risk activity. And to the best of our ability, we were going to try to modulate them. Now, the countervail to that was it took a lot of people at the health unit to be reassigned to follow up on these plans. And so those are, I think, the contextual issues. I think that we owe it to migrant farm workers to have them have self-isolation plans that work. I think it's consistent with compassion. It's also consistent with good practice, and it's good for farmers. So those are the things that might make it maybe different here, but it's not as different as we might think, because as an operational item, the people who run agricultural enterprises and migrant workers are supposed to follow all of those rules. You know, to stay 6 feet apart, to make sure that people self-isolate for 14 days. And I think that we have to recognize now that we already have outbreaks in areas that are proximate but not adjacent. So Chatham, Windsor, and it is concerning. It is of concern to me. So sorry for that long-winded answer, but I'm happy to provide additional clarification as well.
Can I jump in there as well? So it's not just a resource-based decision, though. It's also in terms of some of the challenges. I suspect that what you're getting at, Councillor Rabbits, is some people, why are boat ramps open in location X, but they're not open here? Or car washes is another popular topic. A lot of it comes down to the interpretation of the provincial guidelines, or rules rather, and what their intent was when they created that rule. So in the case of marinas, you'll see that there were a number of locations. People like to say, well, how come marinas are open there, but they're not open in Norfolk County? I'm not sure who they're getting their advice from, but I'm going to read you just a quick letter while I have a chance. Dear so-and-so, thank you for your letter about access to marinas. I appreciate hearing your views and concerns. As you know, our government has issued a list of essential workplaces. Under the emergency order, there are very limited circumstances where marinas can be open. Each marina must determine whether it fits into any of the categories, and if so, make a decision as to whether to stay open. A marina may operate, but only to the extent necessary to enable individuals to access their primary place of residence, including Indigenous communities. For example, there is no land-based route to access the residence. Accessing seasonal cottages is inconsistent with our government's message to Ontarians to stay home and stop the spread. Marinas may operate to support other essential services, including law enforcement, fire, and emergency services. Marinas may also operate to support businesses that produce food, including by fishing or to support the food supply chain. Marinas are not to support recreational or sport fishing. These guidelines set out our government's position on the intent of the relevant paragraphs. Thank you once again for your letter. Doug Ford, Premier of Ontario. So the allegations that we aren't correctly interpreting, the list of essential businesses per the province, I think that, we're doing our best to interpret the law, and while it may not be properly applied in other municipalities, that's not a knock against Haldimand and Norfolk for actually, making the proper interpretation. It's our job to uphold the orders that have been issued by the province, and that's what we're doing our best to do. In the case of car washes, there is washing your car, this is where the ambiguity comes in. Is that essential maintenance? It's tough to determine, right, whether it is or isn't. So it has formed the basis of conversation. Shanker's spoken a great deal about it. Obviously, if it's a car wash where you're not interacting with anybody, the risk of something happening is extremely low. So, it's also a risk-based analysis that goes into it.
Yeah, so, if I could add, Madam Chair, we have to accept that the policy is stay home unless you have some essential item that you have to do. Stay at home. The challenge is that there are some apparent inconsistencies. When I get emails from people, they ask me one thing versus another. The second is that some of these rules are not promulgated. The rules promulgated by the health district we own those, but many of these rules are promulgated by the provincial government. And quite honestly, it would have been my preference that the rule should have been stay home unless you have an essential reason to leave the house. And that would have been easier as a regulatory regime, but that's not what we ultimately ended up with. Some places are open, some places are not. So I think that's one of the challenges for interpretation. But I always acknowledge when people say that, yes, I recognize you may think that it's inconsistent, and maybe it is, but we're doing the best in the pandemic to try to apply the rules as best we can.
Thank you for all of that information. I really appreciate that, both of you. Thank you very much. My next question is along the lines of enforcement and the issuance of orders. It is a controversial topic, and I don't think we should shy away from providing a rationale. People need to know what they can and cannot do, and there are individuals that have received orders, those that have complied, and there are individuals in our community that are sort of trying to tap into that rumor mill. They haven't actually been issued an order, they're unsure, and rather than directing their questions towards those that have the expertise, the knowledge to speak to them, they're asking their friends, they're asking their family, and they're relying on often information they're getting from different types of media. And to that end, I would appreciate, before we conclude our conversation today, to go back to that slide about those different orders that were issued. I appreciate you're trying to be brief and get through your entire slide deck, and I would appreciate if maybe you had an opportunity just to actually get through that one slide that had some orders that were issued, just to kind of give us a really high-level explanation about what was contained on that particular slide deck or that particular slide.
Sure,
I'm also very interested in knowing a little bit more about your relationship with our bylaw team, because those are our frontline staff members that are often interacting when an order is issued, and they often will be getting the brunt of the complaints and sometimes a confused response for those that are ill-informed or uninformed. So in maybe your your high-level overview, if you could just explain your relationship with our bylaw team and how that relationship works.
Sure. So I don't have all the, I don't want to comment on the orders without having them all right in front of me, printed out, but I'm happy to comment on them generally. I have to go to the slide though. Okay. Well, let me get the slide here. So, with regards to bylaw, so when and Paula's here, and she might be able to comment on how bylaw works. Bylaws under the supervision of Paula, and it was part of the adherence or enforcement team. I authorize, in some cases, now these are legal constructs, I also have authorized under the statute, under these extraordinary circumstances, certain bylaw officers and other enforcement individuals to effectuate adherence. So maybe if we could, Madam Chair, if there's a way we could ask Paula to comment on that, would that be proper?
So under the Health Protection and Promotion Act, under Section 41, the medical officer of health is allowed to authorize people to act under his direction for the purposes of inspections and inquiries to enforce the act and orders under it. So recently, for example, a number of people have been appointed to the bylaw team, though they're not MLEO or municipal law enforcement officers. Specifically, though, acting under the direction of the medical officer of health as it relates to the farm migrant orders in particular. So that group of people, day to day, operates under the management team at Public Health, and our medical officer of health establishes the order, and I presume works with, and you would know better than me exactly how that relationship works, but works with the public health staff to effectuate the farm plans, the orders, and then they train our inspectors who then participate in the, I'll call it more of an auditing function as it relates to the migratory farm workers. In the event there was ever an actual enforcement issue, we do have certain bylaw staff who are MLEOs. They are bylaw officers appointed by the county who also have been authorized by Shanker in the event that we were to go to the level of an enforcement proceeding, which is basically a prosecution under the Health Protection and Promotion Act for a failure to follow the requirements of whatever that order is. So that's not limited to the farm migrant worker order. That also involves, perhaps on some level, the most important and urgent aspects of those are people who are under self-isolation orders and who aren't adhering to them. There are individuals who our bylaw staff, have served personally, requiring them to self-isolate. And a failure to do that has sort of two potential consequences. One is a prosecution, which is not perhaps as helpful as we might want it to be if somebody actually needed to be self-isolating and wasn't. The second option is an urgent application to the Ontario Court of Justice asking the court to require someone to attend at a hospital or similar facility and for the police to be authorized to take that individual there. So we have not had to do that yet, but that is sort of how enforcement works under that act. If your question is other kinds of enforcement, so provincial regulations, I don't know if it goes that far, so I don't know if I need to speak to it, but
thank you, Paula. I think that covers it. I appreciate your expertise in weighing in on that topic. It is a topic that has come up, and frequently the source of the question is as a result of having an interaction with a bylaw employee that we have. And so that's why I thought I would just ask about the reporting relationship or how that works with our public health team, and you've answered that question today. Thank you very much for that. I guess without having our IT individual currently for the slide deck, I imagine we'll be able to get those in another form. I don't believe I had them provided to me, so I'll look forward to that follow-up.
Sure, I could call you and we could go over the different orders. I'm happy to do that. Would that be helpful, or do you want me to comment?
Oh, I was just hoping for a copy of the slides.
Oh, yeah, no, I can give it to you at the end today.
Oh, great.
Okay, great.
But I did have one more question, and I would appreciate just a high level about pools. I've received a number of calls about what am I allowed to do, what is considered essential maintenance. It's a large asset. I would say it's comparable to owning a home or an automobile. You wouldn't tell someone not to maintain a very large asset like that, considering it also has water. Water could stagnate. We are hopefully getting into some warmer weather, though I was trying my best not to roll my eyes when the snow was flying and I had people telling me about opening up their pools. But the reality of offering a pool service is there's a lot of swimming pools in our area, and these operators, they really want to get ahead of that workload, because if they don't start and they get into the ground and into the swimming pools, even when there's snow flying, early in the season. They're going to have a backlog of service and tickets that they just won't be able to fill. And so that's a concern. There's also a concern with what is considered essential maintenance, and are people able to get water in their pools or not? And these are the types of questions that I've been asked, and part of the reason why I'm bringing it up is I'm just concerned about the amount of persons that may try to do this on their own. And they may not have the expertise or the knowledge. They might invite others that might be able to sort of do that, and that's going to be going against our intent of minimizing contact and community spread and maintaining that physical distance. Fortunately, it's an amenity that's outside. So having listened to some of my concerns, and I'm basically just articulating what's been emailed to me. We want to know, pools. What's an essential service, and what is not?
Paula's going to take that.
So just to clarify and remind people, there's orders that the medical officer of health issues and that he's directly responsible for, and this is not one of them. So the pool issues is an essential business question, and that is under the province's own act and regulations. We worked this one out, and to my knowledge, it is acceptable to the industry, which is that yes, it's the language of the act requires people involved in property maintenance to be limited to 3 things: security, sanitation, and I can't remember the third. Security, sanitation, and I'm sorry? But there was a word before it, and I can't remember it. In any event, it doesn't matter. Sanitation, security, something like that. So what we worked out with them was, okay, pools as it starts to get warmer, yes, West Nile becomes an issue, standing water becomes an issue, plus the maintenance of a pool has a certain chemistry, which also becomes an issue when it gets too warm. So we basically said, starting May, go ahead and start booking your trips and your visits and get it all done before the heat arrives. And as far as I know, that's what's happening.
Any further questions? Barry Hewitt, you're very quiet. Councillor Columbus. Oh, this is the first time I've seen you. Councillor Columbus, where have you been this whole time?
Sorry.
I think I preferred our screen situation last week better. Can't hear you. Sign language?
On here. Sorry,
So you're showing mute on the bottom, Mike. If you is there on your screen you can see there's a microphone with a line through it.
Okay, am I on now?
They're perfect.
Good, thank you. Yes, I too have been receiving many calls about the 3-person per bunkhouse rule, and I understand how seriously our medical officer of health has taken it. But Norfolk County, Ontario's Garden, is one of the leading producers of fruits and vegetables, supplying majority of the fresh produce to wholesalers and also grocery chain stores during the months of June, July, August, September, October even. And I just wondered if Dr. Necessary has any concern, or the Ontario government has any concern about, with this 3-person rule, the impact it's having on reduced production of fruits and vegetables for Ontarians and Canadians to consume in the next few months, because the acreages, from what I hear, production is going to be down probably to a significant standard. Just wonder if you can shed some light on that. And also, I would like to know if I heard Leamington had 8,000 migrant workers. Just wonder, are they on a 3-person per bunkhouse ruling as well, or just Norfolk Haldimand?
So I'm obvious, food is an important public health priority, access to food, and my dad owned greenhouses, and he worked at the research station in Vineland, so agriculture, I know it's close to how my family made a living. This 3-person per bunkhouse rule is only during the self-isolation period. And that self-isolation period is for everybody, no matter what health district you're in. If you're in, and you cannot work during your self-isolation period, those are the federal rules. So once the self-isolation period is over, people can live in their bunkhouses as they might otherwise, so long as they can meet all the other rules of maintaining the 6 feet distance. And in many ways, these bunkhouses are like large family homes. So the real difference is that in other districts, they are not asking for 3 people in a bunkhouse to self-isolate. They're still required to self-isolate, and during that self-isolation period, they're required not to work. The difference in Haldimand and Norfolk counties are that we are restricting the number of people in the self-isolation residence. The government recognized that this is a challenge throughout the province and offered a $1,500 per worker subsidy as well. There is a countervail to this. If someone is not properly self-isolated, they can end up spreading COVID-19 to the entire bunkhouse, and then the entire bunkhouse could theoretically be on quarantine. That is what happened in British Columbia, is my understanding, and then the farmer could not operate his enterprise because his entire workforce was disqualified from working. But to the first extent, I know I'm a bit long-winded, food is important, and we're effectuating the community gardens, and I'm all for that, and we can put together plans for that. Farmers markets, because it's fresh food, we're trying to formulate plans for farmers markets, and anything that we can do to positively impact the food and maintain also the safety of the constituents of this district, we would do it, and I would support it. So, sorry for the long-winded response, Mike.
Thank you for your answer.
Do you have any further follow-up with that, or? I think Shanker tried to highlight earlier that it's equally being done to protect the farmers, because if you end up with 20 people in a bunkhouse and your risk is substantially increased of those 20 contracting it versus having 1 or 2 or 3, that if one of those 20 does come down with something, the quarantine period for the entire 20 is going to be extended. So in many ways, it's actually protecting the farmers, particularly in light of some of the outbreaks that we're seeing in Chatham right now and Leamington.
An outbreak in a farm would require testing, let's say 20 people, and then all the close contacts of those 20 bunkhouse residents would go on self-quarantine. So it could, theoretically, if you have one outbreak in a bunkhouse, you could end up self-quarantining 80 or 100 people. It's in Chatham, they had to do a test on 250 people, which would be basically the amount of tests that we might do for 2 nursing homes. So it's a big risk for sure, for the farmer, for the people affected, and for the community overall.
So I guess, Councillor Columbus, if I could just kind of follow up a little bit, this ties into the question from Councillor Huffman earlier, just so that you're aware again, of the Health Protection and Promotion Act and how Shanker's decisions are his and his alone. And the only option to those, we each have an equal weight in our vote. If you do not agree with the decision for 3 men to a bunkhouse, would be to move for his removal, which I'm going to assume you're not prepared to do. Councillor Columbus.
No, I'm not prepared to do that.
Any further questions?
This button here, okay, you can hear me. Just if I may, and I appreciate you all having me here today to observe, but to provide maybe a little bit more color, I can certainly say that our meetings and conversations with Dr. Shanker has not been always easy, and I have not been the easiest probably in many instances, but we continue to challenge our public health unit in every way for them to appreciate our position as the elected folk, but also for us to understand and appreciate their position from a health perspective. And while I can say that it's our intent to ensure that we continue to provide that public safety net for our communities, we're always looking for ways to protect our businesses locally as well, and ensuring that if there's an option for pools to be able to continue to work, or landscaping companies, or car washes, as we will, it's both Mayor Chops and my position to try to find that solution that will protect the public, will satisfy the public health unit's position, and at the same time, it gives those local business owners an opportunity to gain some revenue and income. So that's an important piece to that as well. And we are trying to navigate a difficult position with no help whatsoever from our provincial MPP. We've had virtually none whatsoever in that perspective, and that's been a very big frustration for all of us, because it's the province that decided what was essential, what was not essential, and it's the province that should be able to define that. And unfortunately, we haven't been able to truly get to the bottom of a lot of those issues and questions that you all are getting. And we field them all. We try to determine what is essential, what's not essential. We ask for support from the provincial office, and we get the same rhetoric that suggests that we're adding more and more layers to this bureaucracy that exists, and we're not. Shanker has specifically put a number of orders in. Some we may agree, some we may not, but it's certainly his position to make that decision, and we've tried to support our public health unit in the last 6 weeks to ensure that we keep the community together in looking for a better tomorrow versus questioning what it is that we're doing today. And I, like everybody else, want to see us get to that other end, and hopefully we'll get there soon. So again, I thank you for having me here, and know that we're fighting as hard for our communities, as hard for our businesses, and as hard for our farmers, as hard for our manufacturers, as well as we are fighting for those elderly people who are in those long-term care homes that are struggling as well. So thank you.
Thanks, Mayor Hewitt. I would echo everything you just said. I mean, and as you pointed out already, we both have, we may not always agree with every detail of Shanker's plans, but he is our medical officer of health, and it is our duty to support him in the decisions that he makes for the better of our community. Anyone else? No? Okay. Well, thanks again for coming, Mayor Hewitt. We're just going to do our confirming bylaw and so on, which I'm sure you probably would rather get out of here.
Sunshine.
Bye-bye.
All right, with that then, if I could have a motion to confirm the proceedings of the Board of Health held on April 28th, 2020. Could have a mover, Councillor Rabbit, seconded by Councillor Michelli. All those in favor? That's carried. And I guess with that, we'll adjourn the Board of Health. Thank you very much, Shanker and Marlene, for coming today. I appreciate it.
Thanks for everything.
Just for those of you watching, we'll just be back at, I guess, 4:28 to resume our council meeting.
On a strip of sandy soil lies a county called Norfolk. It's Ontario, South Coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Norfolk, 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 you won't be a stranger along. On a strip of sandy soil lies a county called Norfolk. It's Ontario, South Coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for
Feel
more.
free to take me on.
Of North.
Hi, Tom. I can see you waving.
On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long.
All right, I'll now call the council meeting to order.
Take
We do
in-
have two changes to the agenda. One is the deferral of bylaw 4 OP 2020, and the second is the addition of a motion to allow the CAO to act as an MLEO. Although Mr. Burgess will not be acting in this capacity routinely, enforcement and public education are critical at the moment, so it's beneficial for our frontline staff to see their leaders in the trenches with them. If there are no other changes to the agenda, could I have a motion to approve the agenda as amended? Councillor Rabbit, seconded by Councillor Taylor. All those in favor? On screen too, that's okay, that's carried. Any declarations of pecuniary interest? Seeing none, we'll move to the consent items. We have a consent item again. I'm just being directed here to remind council the exemption from part lot control is just a phase to assist in the development. The development itself isn't before council for approval or denial. That being said, if anyone wishes to pull the matter for discussion, please do so now, or we will proceed with the staff recommendation. Okay, could I have a mover and a seconder on the staff recommendation, for staff report DCS 20-29. That's an application that's been received requesting exemption from part lot control to construct a 14-unit townhouse development on 3 blocks of land located on Wyndham Street in the urban area of Simcoe. It's proposed that these dwellings be sold as freehold lots. Mr. Quattrocchi of Mayberry Homes and agent J.H. Cahoon Engineering have put forth the application affecting the lands described as part blocks 1, 2, and 3, register plan 37M-71. Moved by Councillor Taylor, seconded by Councillor Michelli. All those in favor? And that's carried. Now, moving on to the communications, we have 11 items of correspondence, so we agreed before we will not do a recorded vote upon each one. If members could hold up their hands just for a minute on screen there, just so I can see the full vote. The first is the communication from Dennis Trevally, that the communication from Dennis Trevally regarding his resignation from the Committee of Adjustment be received as information, and that the position on the Committee of Adjustment remain vacant for the remainder of the term. I actually just wanted to pull that one and make a comment myself. The recommendation in Mr. Trevally's letter is that the position no longer be filled. So I was wondering if we might be able to send that back to staff to consider the terms of reference and then refer it back to the clerk. If we could adjust the motion any issues with that? Councillor Martin, are you willing to move that? Councillor Martin, seconded by Councillor Rabbits. All those in favor? And that's carried. Councillor Clements, did you have a question?
Yes, well, does that mean we are getting a staff report?
On the terms of reference, yes.
Okay, thanks.
The next is that the communication from Grand River Conservation Authority regarding the municipal levy and budget 2020 be received as information. Moved by Councillor Martin, seconded by Councillor Michelle. All those in favor? That's carried. Councillor Van Passen, you with us?
Yeah, I'm with you. Is my speaker on, or?
You're frozen, so maybe just give us a verbal. Next one, item C, is from Cam Carter, Chair, Downtown Simcoe BIA. The motion reads that the communication from Cam Carter, Chair of Downtown Simcoe BIA Board of Management regarding the request for meeting regarding secondary plan be received as information. Mover and a seconder. Councillor Taylor, seconded by Councillor Rabbits. All those, Councillor Hoffman, did you have a question?
No,
okay.
No.
All those in favor? And that's carried, thanks. The next is the communication from Kendall Zajic, President of Langton Area Minor Hockey Association, regarding the future of our local arenas be received as information and referred to staff for a response. Moved by Councillor Michelle, seconded by Councillor Rabbits. All those in favor?
Mayor, I'm sorry, I'm asking a question.
Okay, go ahead.
If we could just pull that for one slight brief discussion.
I'll turn the floor over to you. Let's have it now.
Thank you very much. The only concern I have with Ms. Sajac's letter is the recommendation by staff is that it be received and referred for an appropriate response. One of the points made in Ms. Sajac's letter was that she has not had a response during some period of time, and I just want to publicly assure her if we are to pass this communication that the response she will get from staff will be in a reasonably prompt and timely manner.
That assurance.
Thank you, Mayor Chop. Through you to Councillor Michelle. So what all you're clarifying is that it be a response to her letter in a timely manner? I'm unclear as to what you're requesting from staff.
Thank you, Madam Mayor. Councillor Huffman, my concern is that one of the items that she refers to in her communication is that she has not had responses, and our recommendation by staff is that they'll respond in an appropriate manner. I just want to make sure that she can be assured, and all the members of those organizations can be assured that because many of the items that they discuss in the letter are timely, and that they won't be waiting an exorbitant amount of time for that response. That's all.
Okay, and thank you, Councillor Michelle. And I just wanted to add, would this be an appropriate time in terms of a motion to reconsider to pull the arena item from the budget 2020? In particular, the COVID-19 has altered our timelines in regards to the RFPs that we were talking about doing with the local arenas, and with the tight timelines And with registration and things like that having to take place in the very near future, I'm just wondering if it'd be prudent that we defer our budget issue until 2021.
Did you want to say? Yeah.
Thank you. Through the chair, just a couple of quick comments. First, the letter from the individuals dated, or the emails dated March 10th. I think subsequent to this, staff have been in discussions with all the hockey associations and getting ice time requests currently. So to answer Councillor Huffman's questions, we're looking at the ice time requests that are coming in from the hockey associations to better position an answer for you, Councillor Huffman, on the timing of that RFP. The RFP report will come to council at the next council meeting, and the timing for that can be discussed. I don't want to presuppose council's decision, but it's anticipated that we would defer that. So I don't believe there's a requirement to change the budget. It's just a matter, we'll set the timelines within that, and staff will manage towards the budget accordingly based upon those timelines.
Go ahead. Councillor Huffman.
Thank you, Mayor Chop. Through you to Mr. Burgess. It was really difficult to hear you. I couldn't make out really everything or anything that you were saying. My apologies.
Sorry. So your specific question of potentially opening up the budget again, we don't think that's going to be required. There's going to be a report coming to council next council session with regards to the RFP. Okay. And staff are in discussions with all the hockey associations to get their ice time requirements. The budget requirement was just to reduce the budget to a certain amount, and we're still confident with certain processes we can maybe still get to that amount for the 2020 budget.
Okay, thank you very much.
Any further questions on that? Councillor Van Passen. Go ahead.
Thank you, Madam Mayor. Is my microphone thing working? Okay. I would assume that staff has already discussed this issue. We got to remember that we're dealing with some housekeeping matters here. That letter from the Langton Minor Hockey is dated March the 10th. You know, where that's I'm assuming that they've already had some discussions with our staff about booking ice time and all that, and it hasn't just been sitting on a shelf. Can somebody assure me that that is correct?
I believe that's what Mr. Burgess did right at the beginning. He said that right away, that they had already spoken with them. Okay. Anything else, Councillor Van Passen? You're frozen, so I can't tell.
Oh, yeah. No, that's good. Thank you, Madam Mayor.
In that case, if I had a mover, Councillor Michelli, seconded by Councillor Rabbits, that the communication from Kendall Zajac, President of the Langton Area Minor Hockey Association regarding the future of local arenas be received as information and referred to staff for a response. All those in favor? And that's carried. Next, that the communication from Steve Clark, Minister of Municipal Affairs and Housing respecting Roma follow-up be received as information. Councillor Martin, moving that, and seconded by Councillor Taylor. All those in favor? That's carried. The next is that the communication from Jeff Urich, Minister of Environment, Conservation and Parks regarding the Provincial Day of Action on Litter be received as information. Mover and a seconder. Councillor Taylor, seconded by Councillor Martin. All those in favor? And that's carried. Next, that the communication from Laura Pettigrew, General Counsel, regarding the Ombudsman investigation be received as information. Moved by Councillor Taylor, seconded by Councillor Columbus. Do you have a question, Councillor Columbus?
No, I'm good with it.
Seconding? Okay, all those in favor? And that's carried. Next is that the communication from John Mascaron, Integrity Commissioner, regarding the 2019 annual report of the Integrity Commissioner be received as information. Mover and a seconder. Councillor Michelli, seconded by Councillor Taylor. Was that a question, Councillor Huffman, or just a hand?
Yes, no question. Thank you, Madam Mayor. Through you to well, I guess through you, I just wanted to, I've had quite a bit of correspondence from residents regarding this Integrity Commissioner report, and there were a few items in there I just wanted to discuss further if that would be appropriate.
Absolutely.
Okay. All right, just a minute. Let me flip to my pages here. Okay. I just wanted to make note that I do agree with the line in the report on page 78 that good governance is not simply about maintaining tax rates. And I think that that's an important piece for us to keep in mind. And I do understand that the number of complaints filed was relatively large. We do think that, I mean, a summary was that because of the inexperience or the new, I don't like the word inexperience, but the newness of the council. But there were a couple pieces that kind of stood out to me, and these are the ones that I've had constituents speak to me about. One of the ones that I would like us to definitely pay attention to is looking at the anonymity of individuals who file complaints and the complaint fee. And also another big thing, and this is a personal one for me as well, is that I feel that there is a lot of prior consultation by members in our council amongst themselves via email or other electronic or digital means in advance of an open debate. And I feel that this demeans our transparency and our messaging to our constituents. So I just wanted to bring those items up for further discussion.
Any discussion from anyone? Okay, I have a motion that's been moved by Councillor Martin and seconded by Councillor Taylor on the table. All those in favor? And that's carried. Opposed?
Opposed?
And I can't see Roger. Can we see Roger? I guess we should have actually been doing a record. Oh no, we said we weren't on these ones.
Yeah. Councillor Geisens, is your mute on there? I don't think we can hear you.
They're opposing receiving the report.
I can see you, Councillor Geisens. Can you raise your hand if you approve receiving the report? All right, you approve.
Okay.
Good.
Go ahead, Councillor Columbus. I did ask you if you had something further at the time.
Oh, it's not the easiest system to work with if you're sitting here. Councillor Huffman has raised some good points, and I wonder if we cannot get a further report from our clerk with respect to the Integrity Commissioner's report and have further discussion on it into the future when we're at the table in person and not missing out on some of the activities that are happening in the council chambers.
There's no activities, so if you have further discussion you'd like to have, let's have it.
Well, I'll put a motion on the floor to defer this communication and receive a report from our clerk or the CAO with respect to the Integrity Commissioner's concern.
We just passed a motion in council by a majority that we receive the report as information. So if you'd like to
Okay.
add something else, I'm more than willing to defer to you right now, but we did just receive it as information.
Right. Well, maybe in your case, you can follow what's going on sometimes, but some of the rest of us that are remotely, you've spoken about Councillor Van Passen being frozen, not being able to locate where Councillor Geisens is. So I'm just clarifying the same issues that Councillor Huffman has raised.
And I'm giving you the opportunity to speak. I asked specifically if somebody else had something to say, so here's your opportunity. But we have passed the motion to receive it as information. So if you'd like something else, now's your time.
Well, I just made the statement. Perhaps, again, you didn't hear me. I had mentioned that I'd like to have a report from either the CAO or the clerk with respect to Mr. Mascaren's and the Integrity Commissioner's concerns with our council, which was raised.
So you'd like the CAO to write a report on John Mascaren's report?
Yes, or the clerk. I don't know which department it comes, which person it comes under, but perhaps Councillor Huffman, it might solve some of the issues and concerns that maybe we do have to reduce our fee so that we are more accountable to the public.
If it assists council, if it assists council at all, the normal fee for an integrity commissioner complaint that you would see in municipalities is around $100. And that's been in place for municipalities that have had them for around 5 or 6 years. So $150 isn't an exorbitant amount for filing an application. And for it's returned to everybody unless it's a vexatious or frivolous request. So the county has not kept any of those funds on any of the complaints thus far. But Mr. Mascaren has a good point. And the same thing with the anonymity. There's two general fields of thought on that, and both have valid points that you have a right to see your accuser, but the other one is that you don't want to be discouraging complaints. So they are valid academic points for either Mr. Mascaren to present, or there is valid points on the opposite side as well for council to consider. That's kind of, I think, the only aspects of the Integrity Commissioner's report that it would be appropriate for any staff to really speak to, because he is independent and does have that kind of jurisdiction. We can't really, as staff, I specifically as the clerk can't really comment on other things he says.
Go ahead, Councilor.
Again, Mr. Clerk, again, I didn't hear whether you said 150 was an exorbitant amount or non-exorbitant.
He said it was not an exorbitant amount, and that all of the money that has been collected has been returned. Once you file the complaint, if it goes to an investigation, they return the funds. The only time the funds aren't returned is if it's vexatious or frivolous. So in fact, they've received their money back.
Okay, thank you.
Councilor Huffman.
Yes, I just wanted to know if there was, obviously there's no appetite for council to discuss the insinuation that there is a lot of orchestration that occurs prior to council meetings. And I do get a lot of feedback about that from the community, that they feel that that is occurring and that the council votes are not as transparent as they should be. And I don't feel that that's something that, if that is the perception in the public, I don't feel comfortable that we just leave it at that. And I would think that in terms of our due diligence and our transparency and our need for change is that we take that seriously and we address that. And we have some discussion and dialogue about that.
Well, what's interesting is it generally would be the ombudsman that investigates those types of complaints and not John Mascaren. So perhaps he maybe is overreaching and making certain statements in his report. Anything further from anyone? Okay. Were you making a motion then, Mike? Is that?
No, I'm not making any motion because it's not going to pass.
Okay. Okay, so moving on then. Next one is that the motion from the town of Bracebridge regarding support for the ban of single-use disposable wipes be endorsed, and that this resolution be forwarded to the Right Honourable Prime Minister of Canada and the Honourable Premier of Ontario, the Minister of Environment, Conservation and Parks, the Minister of Municipal Affairs and Housing, the Association of Municipalities of Ontario, the local members of provincial parliament. Mover and a seconder. Councillor Michelle, seconded by Councillor Huffman. Any discussion? All those in favor? And that's carried. The next item is that Norfolk County Council endorsed the motion for the Village of Merrickville Wolford requesting that the Ministry of Natural Resources and Forestry to respectfully provide supporting evidence with respect to the expansion of wetland designations within their boundaries, and that Norfolk County Council calls upon the Ministry of Natural Resources and Forestry to respectfully review its practices and procedures to include a requirement to provide supporting evidence to impacted municipalities when designating provincially significant wetlands within their boundaries, and that a copy of this resolution be forwarded to the Premier of Ontario, the Minister of Natural Resources and Forestry, the Minister of Municipal Affairs and Housing, the Association of Municipalities of Ontario, and the Rural Municipal Association. Mover and a seconder. Councillor Taylor, seconded by Councillor Huffman. Any further discussion on that? All those in favor? And that's carried.
Madam Mayor?
Go ahead.
Yes, did we do item F, page 71?
No, I don't think we did. No.
My
Jeff, you're-
apologies. I saw the
Clark.
Steve Clark. I thought it was a duplication of the other one. It was the two Steve Clarks, one after the other. Thank you, Councillor Columbus. So the communication from Steve Clark, Minister of Municipal Affairs and Housing, regarding protecting tenants and strengthening community housing acts be received as information. Discussion on that? No? Okay, mover. Councillor Michelli, seconded by Councillor Taylor. All those in favor? That's carried. Next is that the Recreational Facility Advisory Board minutes of March 9th, 2020 be received as information. Moved by Councillor Taylor. You have discussion? Okay.
There's a motion held within there. The general sense would be to expand the terms of RFAB to help them assist county staff in seeking that public input as we go forward here with what we're doing with our facilities. Let me just pull the page up there. 111. I'd like to put that motion on the floor right now.
Okay, motion reads as follows. Whereas Norfolk County Bylaw 2019-22 provides for the establishment of a recreational facilities advisory board, and whereas Schedule A to Bylaw 2019-22 defines the terms of reference for the recreational facility advisory boards and includes the provision that the recreational facility advisory board's terms of reference be reviewed a minimum of once every 2 years, and whereas Norfolk County Council now deems it necessary to review and amend the recreational facility advisory board terms of reference, hereby enacts as follows. That the Recreational Facility Advisory Board be given an expanded mandate to assist County Council and staff by being further engaged on existing recreational facility matters exclusive to those areas and directions already approved in the county's 2020 operating capital budgets. That a liaison working committee comprised of RFAB members and key county staff be established to facilitate the advancement of the group's collective expertise and synergy on current and future recreational facilities, including the Annalise Aquatic Center, and any potential changes to the scope of work required by the pending outcome of the county's provincial and federal funding. Sorry, that wasn't the Annalise, the All Norfolk Community Center. And any potential changes to the scope of work required by the pending outcome of the county's provincial federal funding application. And that the Recreational Facilities Advisory Board, at the direction of County Council and in concert with county staff, undertake to engage the public and recreational user groups to collaboratively develop viable options for the long-term needs and uses of the facilities whose future framework has not already been approved by Council in the 2020 operating capital budgets, and that the Recreational Facility Advisory Board, at the direction of County Council, undertake in conjunction with county staff and recreational user groups to develop a comprehensive communications plan going forward. Any comments from staff on that? Jason?
Well, I think one of the challenges with this is that the RFP that's going to come forward is looking for community groups to either partner with Norfolk County, and that could be as far as fundraising or doing other things for particular associations. So I would have to get my head around, frankly, how you'd have another committee involved with that, where you may have community groups. I think it's fairly public that Delhi Chamber of Commerce, for example, came forward with some ideas for what they'd like to do in Delhi. So I would be a little concerned with how that would play out. Also, I think with this expanded terms of reference, it might be wise to go back and say, how did those people originally get appointed? Was it more towards the all community hub, or was it truly a broader sense of it? So I think if you're going to reconstitute this committee, you may want to go back and take a look at right from the start to say, if we want this recreational committee, who's should be involved in it. There may have been people in the community that would have participated if they knew it was going to be a much more expanded one, that they won't have the opportunity to participate because they weren't part of this original one. So just some things for council to consider.
Thank you, Mayor Chop. If I could build on the minutes coming out of this meeting, this essentially evolved around wanting to do more, but the committee was feeling as though they were handcuffed in some way, shape, and form with not being able to or feeling as though their terms of reference didn't allow for them to reach out to staff and build on what was happening in other communities, recreationally speaking. However, the terms of reference were set for the Simcoe pieces of infrastructure that we were looking to deal with. So I don't know if I entirely agree with the terms of reference as printed and brought forward, but I do think it's time that the group either grows into something a little bit more, or the terms are just simply updated, and maybe a simple staff report can come back with some options for council to consider how we want to go forward at this point in time, should the terms of reference change or stay at all. I don't know that they need to be adopted as printed on page 111 and 112, but I think that the group is ready to either be able to dig in a little farther or have clarification on what those terms are. It is a new group. It wasn't alive for very long prior to this council coming in, and then we further developed what that committee consisted of, so maybe it's time just to take another look at it.
Councillor Huffman?
Thank you, Mayor Chop. Through you to Councillor Martin. In terms of, I apologize for this. It's difficult hearing some people, so I just wanted to clarify what I'm hearing. So my understanding was that in regards to the terms of reference change, that stemmed from some individuals on the board being, I can't think of the word I really want to use, maybe felt that they were blindsided by some of the changes to the closure of the rec center and things like that, and the committee feeling that they should have been part of that decision making. Is that correct?
If I may, Mayor Chop, through you to Councillor Huffman, I believe that was certainly a conversation that did happen in RFAB. However, as you know, it's not this council doesn't have the ability to share closed session information with anyone, let alone committees, prior to making our budget decisions. So when all was said and done, they did not include the specifics of being included in those types of conversations in their terms of reference. But I think that they had a broader conversation as a small working group amongst themselves, and decided that they wanted to have a bigger seat at the table with regards to other pieces of recreational infrastructure countywide.
Okay, thank you very much for that clarification.
Councillor Taylor?
Thank you, Madam Mayor. And like Councillor Martin said, I think I'd actually be more happy, instead of this happening verbatim, I think I would like to see a staff report come back with options regarding the terms, what that would look like regarding a bit, allowing this group to really dig in a bit more and see what they can do to help out staff and that sort of thing.
Okay. Is there a seconder for that motion? Councillor Martin? Councillor Columbus? Question?
No, I second it.
Okay.
Seconding.
Lots of seconders. Councillor Martin, go ahead.
Thanks, Mayor Chop. I just would like to add that I would like to give staff the freedom to go outside of that as well. If there's an alternate solution that hasn't been brought up here, or in the language of Councillor Taylor, allowing the committee to dig deeper and work with staff, if there's also another alternate option that you think is best suited, then I would like to see that come forward as well. Thank you.
And just so council's aware, the membership of all the RFAB members expired at the end of January, so we have been allowing them to continue on. But in this report, would you like us to bring back new terms of reference for council to consider before re-advertising for those positions?
I think we should probably have the discussion before we re-advertise.
Yeah,
We'll leave them as the current. Does that work for you guys watching? Councillor Huffman, Councillor Columbus?
Yep.
Yes.
All those in favor? And that's carried. Next is that the Energy Conservation Committee minutes of March 6th be received as information. Any discussion on that? Mover and a seconder. Councillor Taylor, seconded by Councillor Michelli. All those in favor? That's carried. The next is that the Climate Change Committee minutes of February 21st be received as information, moved by Councillor Michelli, and need a seconder. Councillor Taylor. All those in favor? Carried. Next, I'll need a mover and a seconder that the Delhi BIA minutes of February 13th, 2020 be received as information. Any discussion on that? Councillor Columbus, discussion?
Just to move.
Okay, Councillor Columbus, seconded by Councillor Huffman. Okay, all those in favor? Carried. Mover for the public, Norfolk County Public Library Board minutes of January 22nd, 2020 be received as information. Moved by Councillor Michelli, seconded by Councillor Martin. All those in favor? It's carried. Next is that the Norfolk County Accessibility Advisory Committee minutes of January 21st, 2020 be received as information. Any discussion? Councillor Martin?
Thank you, Mayor Chop. I know Shelley is here, but she's not in the room with us, so I might even be able to ask this question. It's a procedural question of Councillor Huffman, possibly. Page 131, 10B. There are a list of sidewalk and road repairs. Does Marie send that directly off to our public works staff? Is this something that, as a council member, I should be looking for my community and be sending it off? How does that work when you have the discussion in that committee?
Councillor Hoffman.
Okay. Thank you for that question, Councillor Martin. No, that information goes directly from our committee to staff in regards to the sidewalk and road repairs. So that goes directly to them. So as your role as a ward councillor, you wouldn't have to, I mean, I guess certainly you could follow up on it if you want, but you're not responsible for reporting it.
Does that answer your question, or did you want Shelley to?
Did you catch my? Okay, Shelley's here. Thank you.
Thank you, through Mayor Chop. That's correct, through Councillor Huffman. Any information that's provided at the Accessibility Advisory Committee, we send to the appropriate work order system for staff to follow and action up.
Okay, so again, a mover and a seconder that the Norfolk County Accessibility Advisory Committee minutes of January 21st, 2020 be received as information. Councillor Taylor, seconded by Councillor Martin. All those in favor? And that's carried. Next, that the Downtown Simcoe BIA minutes of January 15th, 2019 be received as information. Moved by Councillor Taylor, seconded by Councillor Rabbits. Any discussion on that? Okay, all those in favor? That's carried. And that's the last of the communications. Let's take a 15-minute break if that's possible. So we'll come back at 5:20 and we'll begin with staff reports.
Okay.
On a strip of sandy soil lies a county called Norfolk. It's Ontario's south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Norfolk, 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 you won't be a stranger along. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Norfolk, 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 you won't be a stranger along. On a strip of sandy soil lies a county called Norfolk. It's Ontario, South Coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of North on a strip of sandy soil lies a county called Norfolk. It's Ontario, South Coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario, South Coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of North. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of North on a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk.
Can you guys see each other?
Won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more.
I would have figured.
Norfolk, my
I would have
cousin
figured Roger would
county
have
home.
had more
Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long.
I think I liked the bigger screen last time around.
With hard work, we built a
Well, it's
dream
nice because you're right
that
in
only
front of
willing
us. Like you're
hands
on the
could
little
do.
screens. That part is nice.
It's on display at
I
our
don't know, it's
fall
hard, like,
fairs and at
miss your
all the
hand or
festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk,
It's hard to figure out who is actually speaking.
I think it's Monty.
You won't be a stranger long.
I thought I heard Monty talking earlier.
On a
Yes,
strip
you're right.
of
It's Monty.
sandy soil
Monty and
lies a
Mr.
county
Burgess are having a
called
sidebar
Norfolk.
conversation.
It's Ontario, South Coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see
Are we getting
why
started
we
again?
love it here and are proud to call
Did we miss
it
the
our
meeting here?
Norfolk, Norfolk,
I think we're getting it started soon.
Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of North. On a strip of sandy soil lies a county called Norfolk. It's Ontario, South Coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at
All right,
all
looks
the
like we've got more there
festivals
anyway. I
too.
skipped over the approval of minutes. We have a regular council minutes from February 18th and the special council minutes from February 7th before us. If there's no errors or omissions, they will be declared adopted. Okay. So first staff report is staff report ECS 20-09. That's in regards to the summary of bid awards for the period February 25th, 2020 to April 21st, 2020. And Shelley, I guess that's you. Thanks.
Thank you, Mayor Chop. This report presents a simplified bid award report request to Council, outlining the various bid results from formal bidding opportunities that have closed during this period. The bidding opportunities have been developed and issued in accordance with Norfolk County's purchasing policies and procedures, and the recommended bidder has been proposed on the basis of having submitted the lowest compliant bid that meets the minimum specification. Staff are seeking approval for the respective general manager to execute contracts with the successful bidders and also initiate the applicable budget amendments and the issuance of debenture as outlined in the specific recommendations. There is one recommendation contained in the report that requires an amendment, and it relates to request for tender PWR 20-33B, catch basin cleaning for 2020 to 2022. The second part of the recommendation on page 138 of your agenda package, in the middle of the page, should read, and that the 2020 operating budget be amended to increase the 2020 catch basin cleaning program from $60,500 to $134,600, with funding to be provided through reductions in various road maintenance services. This streamlined approach to bid award request has eliminated the need for 9 separate reports while providing Council with a detailed summary of each request as outlined in Attachment A of the report. Staff will assist with any questions that Council may have.
Questions from councillors? Councillor Columbus.
Yes, my first question is with respect to the reductions in various road maintenance services. It's mentioned in a couple of these recommendations. And what will we be getting a list, or can staff comment on what kind of services will be cut to make this tender happen?
Thank you. Through the chair, Public Works can certainly put a list out. In some cases, it's just a quantity reduction, so the total amount of kilometers or meters might just be reduced to have the savings. So it might not be a specific area, but Public Works, once approved, can provide an information memorandum to council.
Okay, I had difficulty hearing you, but did you say that we would be getting a list of what that would be?
Yeah, Public Works will provide a memorandum to council, councilors on that.
Okay, thank you. My second question is with respect to hot mix asphalt in the urban areas to Cocoa Paving. There's $106,000 where we're saving with respect to that tender. And I just wonder, with petroleum prices being as low as they are, I take it that's why we got the low bid. Would it not be worthwhile to do additional paving to use up the $106,374, being that the oil prices are low, to make this this asphalt mix?
Through the chair to the councillor, that is potentially one strategy. The challenge is part of the hot mix repaving is where potentially some of the savings to pay for some of the other projects may come from. So Public Works in that memorandum can provide provide additional comment on whether they can stretch that out a little bit further while still maintaining their savings.
That's what I'm thinking is we should perhaps utilize that and stretch it out while oil prices are low.
I think the last report there, Mike, we started at $90,000 and it's now $1.5 million job. So this money got to come from somewhere.
Okay, thanks.
Any further questions? Okay, with, can I have a motion to move the staff recommendation with Shelley's one amendment in there? Councillor Rabbits, seconded by Councillor Michelle. Any further discussion on that? All those in favor?
Recorded vote?
Oh, my apologies. Yeah, sorry.
So we'll start with the electronic participants. Councillor Columbus?
Yes.
Councillor Geisens?
Yes.
Councillor Huffman?
Yes.
Councillor Van Passen?
Yes.
All right. Councillor Rabbits?
Yes.
Councillor Martin?
Yes.
Councillor Michelle?
Yes.
Councillor Taylor?
Yes.
Mayor Chop?
Yes.
The motion carries.
Next is staff report FS 20-14 regarding capital status report as of December 31st, 2019.
Thank you, Mayor Chop. Kathy LaPlante is going to present this report today.
Thank you, Mayor Chop. The capital status report includes a summary of all open capital projects as of December 31st, 2019. The list provides the approved budget and expenditures as of December 31st, 2019, plus comments related to the status of each capital project. In addition, if the project has been completed, a recommendation has been included to close the project, and if needed, a recommendation for funding has also been proposed to fund any over expenditures. One area to note is on page 146 in Table 1. It lists the amendments that have been approved throughout the 2019 calendar year. Most of these amendments have been funded from reserves and reserve funds or debt. This results in an unfavorable impact on reserves and also increased requirements to issue debt. The only exception, which is a good news story, is the Norview UVC disinfection system project. It was actually funded from donations, 100%. The other area to note is on page 147, Table 2. It outlines that out of the 198 open projects, 135 have been recommended to remain open, and 63 have been proposed to be canceled or closed. Based on the projects proposed to be closed, overall completion of the projects have been completed under budget by approximately $4.5 million, which results in a favorable impact to forecasted reserves and reserve funds, or less debt to be issued in the future. Just so that council to note to council, staff have been reviewing and discussing potential streamlined processes relating to capital projects and capital variances. And as a result, discussions have taken place, and staff will be bringing forward a proposed change in policy regarding capital variances in order to produce and project flexibility while applying funding to capital projects and to assist in completing projects on a more timely basis. Basically, the previous comment by Councillor Columbus, can't we use savings from one project to another project? That is something we will be looking at once projects have been completed. So at this time, I'd be pleased to answer any questions that you may have, and if I cannot answer, usually most of the questions are directed to Public Works, so Jason is here to answer any questions that you may have. Thank you.
Questions from councillors? No questions? Councillor Van Passen, you're good? You're frozen, so I can't tell.
Yeah, I have talked to staff about a few of them already, so I've had all my questions answered. So,
Okay. In that case, does somebody wish to remove the staff recommendation on page 148? Councillor Michelle, go ahead.
Thank you, Madam Mayor. Kathy, I'm just asking on page 147, it indicates near the bottom of that page for council's reference, that at this time the effects from the current COVID-19 situation is expected to have only a minimal impact on the ability of staff to complete the capital projects noticed in this report. Is that still true as of this current date?
Through the mayor to Councillor Michele, yes, that is still true. Staff are moving forward and diligently completing the 2019 and prior projects, especially the larger projects within Public Works and in community services. And they've also indicated, again, especially in Public Works, they are moving forward with their full capital plan at this time.
Thank you.
I just had a question. I just can't remember what page it's on, actually. 1 second. Sorry. I guess just, Jason, if you could maybe comment on what the Port Dover wastewater treatment plant, how that's coming along. Godby. Well, while we're just talking about capital projects, how's the Simcoe wastewater treatment plant upgrade coming along? Or Port Dover?
Through the mayor to council, the Port Dover wastewater treatment plant, currently we have basically our 90% engineering design done on. There's actually going to be a little further discussion with one of the other reports later in the evening, which might be the more appropriate time to get all into.
Thank you, Madam Mayor. Jason, I'm just going to ask if I can, and I know that I'm referring to item number 75 on page 155. It refers to the, and I realize that this is a closed project, but it's about a generator, and it's the Port Dover Fire and the Walsh Tower, and I'm sorry, I'm not familiar with the Walsh Tower. If you could tell me what that is.
Through the chair to Councillor Michele, unfortunately I don't have a great deal of details on the Walsh Tower, other than I do know from our own history it's a county-owned communication tower that we have in Walsh. It has some of the fire dispatch radio equipment on it. We do have another lease for some of our other communications on that as well. So I believe the intention of that generator more than anything is just to provide continuity of service when it comes to some of our emergency services and those dispatch functions.
Thank you.
Any further questions? No? Okay. Somebody wish to move staff recommendation on page 148? Councillor Taylor, seconded by Councillor Huffman. All those in favor? Oh, sorry. Recorded vote.
Councillor Columbus.
Yes.
Councillor Geisens.
Yes.
Councillor Huffman.
Yes.
Councillor Van Passen.
Yes.
Councillor Rabbits.
Yes.
Councillor Martin.
Yes.
Councillor Taylor.
Yes.
Councillor Michele.
Yes.
And Mayor Chop. Yes. The motion carries. Thank you.
Okay, next report is staff report FS 20-16, 2020 tax policies. Kathy, is that you again, or? Oh, Sue.
Thank you, Mayor Chop. Through you to the rest of council. I hope in front of you tonight was a revised page 5 of this report. I apologize, but I realized an error in the 2019 figures just this morning. And my explanation on there is that when I went to prepare the report, I used 2019's proposed figures rather than the approved figures after the 2019 report. And the only thing that substantially changed was a reduction in the farm tax ratio last year. So those are actuals, and I apologize for having to send that out so late. So I won't go through the entire report. I know it's lengthy. Each year, municipalities must pass tax policy by law to form the basis for the final tax levy. The purpose of the report before you is to set the tax policies for 2020, which will then be used to set the final tax rates. The decisions that Council makes today will be included in a tax policy bylaw for approval at the next meeting. Issues such as tax ratios, reductions, and installment dates are regularly included in this annual report. As noted in the report, the tax increase estimates provided during the 2020 levy operating budget deliberations were based on the premise that the 2019 approved ratios would stay status quo, and staff is recommending the status quo for 2020. In response to the COVID-19 pandemic, Council authorized the payment of the two 2020 interim tax installments could be deferred to July 31st without penalty. Due to this change in timelines, staff is recommending that the final tax installments be delayed until the end of September and November rather than the usual August and October. Because of this deferral to July 31st, final bill prep will occur in August after the July 31st payments have been processed. Council will recall approving new tax classifications in 2019 for small-scale on-farm businesses. In order to continue providing the reductions to small-scale farm business, Council must approve the classifications every year. The report also seeks Council's approval to begin phasing out the tax reductions to vacant and excess commercial and industrial land beginning in 2021. This will provide time to make the business community aware before a phase-out begins. Council would like to discuss or ask questions about any of the topics in the report, I'd be happy to answer your questions.
Questions from council? I have a question, Sue. How do we get to like the multi-residential, commercial, industrial, so far out of the range of fairness?
Through the mayor, to the mayor. These ratios have been in place from the beginning, and so when I contacted the Ministry of Finance for a little history on the subject, and I was in a lower tier municipality pre-tax reform in 1998, and as it was explained to me that the ratios, the ratios that were put in place were specific to each municipality and their circumstances. So, for example, there used to be in the business world, there was a realty tax bill for commercial and then a business tax bill. So there were two tax bills to each business owner. And what this did was combine it, so it's a blended ratio. So to make a long story short, they were provided from the province, I believe 2 municipalities as a starting point. And in Norfolk County's case, since 2001, those ratios have not changed, with the exception of last year when the farm tax ratio changed.
And then that was distributed over what? To the
farm?
Yeah, that when we made the reduction to the farmland, was it applied then, did it stretch those other range of fairnesses?
No.
I never realized how far apart they were.
No, so what those mean, actually. So in the case of the commercial, 1.629, so for every residential rate, we multiply it by 1.629. So by us reducing the farm to 0.23, it just shifted a little bit of burden to each of the other classes, but it
That's what I'm
didn't
saying. It
change
went
the 1
equally
point
to each of the other classes.
in proportion.
Okay. Any other questions? Councilor Shelley?
Thank you, Madam Mayor. Through you to Sue. Sue, you included on page 170 of the report about midway through that there is a misconception that a rise in assessment value automatically translates into more revenue for the municipality. And I do want to thank you for including that in the report. That is a very widely held misconception. My question, though, is today, you indicate that instead, reassessment results in a redistribution or a shift in the tax burden. I wonder if you could just explain that a bit further.
Certainly, through the mayor to Councilor Michelli. If we take the case of, just in simple math, if all the properties in Norfolk County are worth $10 billion and the taxes are distributed based on the burdens that were given in the tax ratios, if next year nothing changes except for the value of all the properties collectively, they become $20 billion, everything in proportion doubles. So you're just redistributing the pie. Your share of the pie stays the same in proportion to your neighbors. So all things being equal, if there was no change in assessments, your share proportionately changes along with your neighbors. Does that explain it?
Yes, thank you. It does.
Other questions? Okay, would somebody like to move the staff recommendation or propose an alternative? Staff recommendation, seconded by Councilor Michelli. Is that a hand for discussion, Councilor Columbus?
No, I just wanted to vote.
Okay.
We'll start with you then, Councillor Columbus.
Yes.
Councillor Geisens?
Yes.
Councillor Huffman?
Yes.
Councillor Van Passen?
Yes.
Councillor Rabbits?
Yes?
Councillor Martin?
Yes.
Councillor Michelli? Sorry.
Yes.
Councillor Taylor?
Yes.
Mayor Chop? Carried.
Next report is staff report FS 2018 regarding the water and wastewater financial sustainability rate study. Kathy, thanks.
Thank you, Mayor Chop. This report is seeking Council's approval to move forward with a water and wastewater rate study that had earlier than previously recommended, given the length of time and needed to complete an urban water supply operational study and Haldeman County's rate study. In addition, we feel there's a need to actually move forward, as the most recent actual study was conducted back in 2015, so it's almost, or going to be over 5 years old, so we feel it's a time to move forward, and there's been lots of changes. For example, the operating and capital budgets, they have changed significantly for water and wastewater services. Plus, there'll be additional pressures as a result of asset management plans coming forward and any results of infrastructure studies and the results and studies such as the Port Dover and Simcoe Port Dover wastewater projects that will be coming forward. Moving forward with the rate study will also be Council's opportunity to set their objectives and establish principles and guidelines to determine Norfolk County's future rates within Norfolk County. As we discussed before, the previous study was set and the rates were set based on very definitive council-approved principles and guidelines and objectives. This is, at this point in time, this will be presented to council so that they can actually make their decisions on how they would like to move forward and establish guidelines for the consultant. In addition to this, we're recommending a single source for this study and to engage Watson and Associate Economists Limited at this time. They've also been approved to complete Norfolk County's development charges background study and to complete a community benefit strategy. So we feel single sourcing this to this consultant will result in synergies and cost savings, most definitely. So Council has any further questions, I'd be more than pleased to answer them.
Questions from councillors? Okay, somebody wish to move staff recommendation? Councillor Martin, seconded by Councillor Taylor.
Councillor Columbus. Councillor Columbus?
Yes.
Councillor Geisens?
Yes.
Councillor Huffman?
Yes.
Councillor Van Passen?
Yes.
Councillor Rabbits?
Yes.
Councillor Martin?
Yes.
Councillor Taylor?
Yes.
Councillor Michele?
Yes.
Mayor Chop?
Yes.
Motion carries.
CAO 20-07 regarding the incremental tax waiver and bridge program. I guess, Jason, is that you?
Thank you. Through the mayor to council, the report before council today is to seek a reconfirmation of a previous council decision to essentially waive the incremental property taxes associated with a pipeline proposal for the next 10 years. This program was previously approved by council. The Enbridge Group was not successful in that pitch and is repitching it under the new funding that's been provided by the government of Ontario and requires a reaffirmation of council's interest to waive the incremental taxes. There's two ways to look at this. This pipeline would not be built without the government incentive, and therefore you would never receive these incremental taxes, and therefore waiving the first 10 years still provides council with revenue that it wouldn't receive in years 11 to likely 40. Additionally, there is a distinct benefit to the users by being able to bring natural gas into those locations. So that's why staff is recommending that council again agree to support the waiver.
Any questions from council? Councillor Columbus.
Is there any estimate of the dollar value of this forgiveness?
Through the chair, there was some estimates provided. However, the final planning isn't done, so the valuation of the pipeline is not known at this time. So it is a bit of a guess, but you're probably looking at I believe Sue gave me the number that was estimated before. I believe it was in the $20,000 range per annum that would be waived. But if I've got that wrong, Sue will correct me on that.
Thank you.
Councillor Van Passen.
Yes, thank you, Madam Mayor. You just got to look at this, that if Enbridge does not put the gas line in, there never will be any taxes. So we're not really giving them back anything if you look at it that way. So I would love to move this motion and get the natural gas line down into Normandale and Turkey Point. And if you would take that as me being the mover, I'd be happy to support it.
Seconder, Councillor Taylor. Any further discussion? All those in favor? Oh, sorry, my bad. My bad.
Columbus.
Yes.
Geisens.
Yes.
Councillor Van Passen.
Yes.
Councillor Huffman.
Yes.
Councillor Rabbits.
Yes.
Councillor Martin. Councillor Taylor.
Yes.
Councillor Michele. Mayor Chop.
Yes.
Carries.
Next report, probably the best report of the night, staff report CAO 20-10, the coronavirus recovery plan. And I guess it's over to you, Jason.
Thank you. Through the mayor to council, I promise I will not use the term, this is a roadmap, not a calendar, for those who've been paying attention with some of the provincial media. And for the record, we had ours put in print before the province's three-stage plan. So anyways, what's before you today is for approval of what we're deeming a framework, a planning framework for recovery. To be fair, these are uncertain times, and sometimes in uncertain times you can take kind of two paths. You can say, well, we don't know what's going on, so we're not going to make any plans, or you can develop a framework or a playbook that you can use as a reference point to make your plans going forward. Staff is taking the second approach by developing this framework to outline both internally to staff members and to the public that Norfolk has a plan. It will be guided by some key frameworks through the 3 stages that we perceive as recovery. We did put some timelines in there, but those timelines are really just for planning purposes, and we try to stress it very clearly through the document. The public health team will dictate the timelines, and the virus will dictate the timelines. So what's outlined there is for planning purposes. And so what we did was pull together a report. We tried to keep it fairly short and to the point. It's attached to the recommendation. But on a very high level, there's 3 distinct phases as we see it. The first phase is what we're in right now, state of emergency. The pure focus is on containing the pandemic. At some point in time, we'll move into a guarded phase. That's where there's the easing of the emergency and there is some preliminary recovery. That's what everyone's talking about right now, and people are going through different stages of it. That's where we'll move to in the next phase. And then the third phase is where there's more fulsome recovery and more return to, I'm not going to call it normal, but to a new normal. And in the report, you'll see through each of the phases where what are some of the key activities for both public health and some of the key activities for the county that we'll be doing. On the recovery side, I do want to stress that we are currently developing an economic recovery plan and figuring out where we want to put our resources to that. We will be reaching out and creating some key focus groups, very widespread, post-secondary institutions, accountants, lawyers, businesses from all the industries will be involved in that to bring forward ideas that then we could utilize to move forward in that recovery stage. Most of that activity, we're starting that right now, to be fair. We're starting to put the groundwork in place now so that we're able to hit the ground running when we need the full recovery. So that's the plan that's been developed. Internally, staff is mobilizing around the plan and developing sub-plans around this. And as I said, the one thing I want to stress is the dates are there for just for planning purposes. Those dates will change as we move through this, but I'd be happy to answer any questions on this.
Questions from councilors? No questions? Wow. Councilor Ravis? No? Okay. I guess in that case, if I could have a motion to move the staff recommendation. Councilor Martin, seconded by Councilor Michelle. All those in favor? That's carried.
Sorry.
Oh,
Sorry. Councilor Geisens. Sorry, Councilor Geisens?
Yes.
Councilor Columbus?
Yes.
Councilor Huffman?
Yes.
Councilor Van Passen?
Yes.
Councilor Rabbits?
Yes.
Councilor Martin?
Yes.
Councilor Taylor?
Yes.
Councilor Michelle?
Yes.
Mayor Chop? Motion carries.
Staff report CAO 20-11, Public Works and Procurement Matters.
Thank you. Through the chair, I'll start off the report, and Mr. Godby's here to fill in more details. But the reality of this report is that current staff in water and wastewater and Mr. Godby noticed some irregularities when reviewing 2 significant capital projects, the Port Dover wastewater treatment plant and the Simcoe waste treatment plant. Based upon, essentially there was, in the case of Port Dover, There was one engineering award made under an RFP process of approximately $90,000. Currently, the engineering fees paid now exceed $1 million. And there's a requirement for additional fees to be paid to take the contract to the next phase. It wasn't as if these were over budget. The budgets were maintained. The challenge or the issue with this was whether staff sought appropriate approvals at the correct times and the transparency of the project. So we wanted to make sure we had timely disclosure of these facts as it came forward. There's also an issue with the Simcoe wastewater treatment project also, though that is of a smaller scale. So we wanted to raise it so that council was transparent of what was going on and what was the finding of it. And then it led to a different discussion that we're seeking approval from council on. One is these are significant projects. The combined total is likely going to be about $50 million. These projects have taken several years to come to the current state. There's been significant turnover on staff on the county side and also turnover on staff on the engineering company side. And the projects grew in scope, so additional scope was added to it. So prior to awarding an additional single source to move to the tendering and contract management stage, staff is recommending an option that we take a very small pause of 4 to 8 weeks to obtain what's called a peer review, an engineering peer review. The previous terms used to be a value engineering assignment, but this is where we bring in an independent engineering firm to review the plans to date to ensure that what was designed is still appropriate, and if there's any potential savings, to look for those savings in design. And we think that if we provide that, it's good capital management practices, but it will also give council greater confidence that even though there was a single source awards provided without the utmost of transparency, that the end project is still, we can still have confidence in the $50 million that we're spending. There is some downside to it, which is outlined in the report. There is added cost to undertake this additional review, and there would be likely 8 weeks added to the timeline for these projects. So that's the recommendation as we move forward. This would be a new practice, frankly, for Norfolk County. It's not, my personal view is it's a good practice for significant capital projects to have a second set of eyes on that, on the project to drive to better results. It's like buying insurance sometimes. Sometimes you're spending money that you don't necessarily get any value back for it, but if you do obtain value back for it, even if it's a 1 or 2% savings on a $50 million project, it'll more than pay for itself. So that was the rationale behind it. But both Mr. Godby, who has far more greater detail on how we got here and on the nature of the projects, are there and can answer those questions, or I can answer questions on the procurement, the modified single source procurement that we would undertake to get a peer review done.
Did you have anything to add?
Through the mayor to council, generally speaking, I believe Mr. Burgess covered the most of it. I guess really there's a few kind of key points with these projects that I just wanted to highlight. They're in the report, but more than anything I want to verbalize them for anybody who's listening. That we don't suspect that there's any issues with the work that's going on. And there's no suggestion that there's been any improper practices done here by any of the engineering firms that we've been dealing with. Both of these two wastewater projects have been reviewed by the Ministry of the Environment, Conservation and Parks. Their reviews have been completed. They've issued us a certificate of approvals based on that design. So they are satisfied we could move forward that way. At the end of the day, just a highlight of the Port Dover project, it does include a minor capacity expansion, as well as laying the foundation for a future larger scale capacity expansion when that community requires substantially more of an ability to treat wastewater. Simcoe is essentially a major overhaul of the existing facility. It is an aged facility where we've done upgrades over the years and certain aspects have just never been touched. There's a number of compliance issues with ESA and TSSA that we need to have addressed as well. Both of these will result in improved effluent quality from the facility, which is poured over discharges into the lake, and Simcoe discharges into the Lynn River. So I mean, from an environmental benefits side, those are great things as well. And both of these projects are, like I said, almost ready. Simcoe is tender ready. Poured over, there's some few finalization of the engineering design that needs to be completed pending the approved scope change. And they will both take approximately 3 years to fully construct.
Questions from councilors? Councilor Martin.
Thank you, Mayor Chop. I just would like to go back to the beginning of this report and make sure I have a clear understanding. So maybe I'll send these to Mr. Burgess, just so I'm on the right page here. This report, our report came to council in 2010 with a request for $90,000. Is that correct?
That is correct. It was an RFP award.
And since 2010, there has not been another report to council with a request for funding, yet the total fees paid to a firm are now $1 million with a request for more.
That's correct on the award side. There would have been reports through the budgeting process showing the increase in dollar scope, but not in the actual awarding, single source awarding of additional contracts. There was, staff took a look and do not believe that there was any additional reporting than the first one for the award of the contract.
And so what exactly has happened over the last 10 years since 2010 when a request came forward for $90,000?
I'll start the answer, and Mr. Godby will probably fill in the details. My understanding of the situation is that as engineering projects, the first 90,000 was for preliminary type of design, and then you have that, and then you add on additional scope for additional items, and then you move to from early stage design all the way up to final design for contract tendering purposes. The existing firm was essentially provided those contract extensions to move from that initial award to where we are today, which is it's a tender-ready project.
So I can appreciate that you weren't here and Mr. Godby wasn't in the position that he was in, but I just want to be as clear as possible. This firm has received more than $1 million. There's a request, or $1 million, there's a request for more money in this report here. In the last 10 years, the project's not been completed and it didn't come forward to council as a formal request for more money to said engineering firm, although it came somehow, some way in a budget.
That is correct. I will say that the engineering firm in this case was actually was the one who provided significant information to fill in some of our holes, frankly, on how we actually ended up getting to this point. So from the engineering firm's point of view, they did what they were told to do, and in fact, they had better information in their files than we did. So
I guess I'm not questioning the engineering firm. That's not my wheelhouse. Public Works isn't my wheelhouse. I'm maybe trying to drive away at a point here that a considerable amount of money has been spent without it coming forward to council. And that could go for any project, but certainly I think it's probably very easy to say that this is the single largest project in the Port Dover community anyways, where we're in a bit of a pickle right now, and this is 10 years in the making. So my next question would be, what reporting systems have been put in place to ensure that this isn't happening and this council, or whatever council of the day, is being consulted?
Through the chair, there are policies and procedures in place currently that this should not have happened, to be frank. So we are reviewing how we can ensure better compliance to the awarding of these type of contracts and putting some additional procedures into place. Unfortunately, this is happening at a time when there's lots of other stuff going on, so we would have preferred to have a more fulsome report to you on our corrective action. But what's in the report is that staff is going away to work with Public Works to ensure that these contract extensions get reported more fully. It doesn't mean that we may not have ended up in the exact same position. You may have ended up in the exact same position, but there would have been a lot more transparency around it. Additionally, from a transparency point of view, a project that lasts 10 years to get to essentially tendering stage, not even construction, you're going to have another 3 years of construction period. There should have been greater transparency to council and to the public as far as how this project was progressing. So that's another part that we'll work on going forward.
I guess, if I may, Mayor Chop, just my thoughts on this and reading this in general, I'm not looking to place blame on any one particular person. I understand how there's been considerable turnover and things can happen. I'm not looking to place blame on staff nor a company in particular, but in general, I would say this is completely unacceptable, and there's an entire community at large who has been waiting in the wings for some type of updates or work to be done, and people put their trust and their faith in the entire institution of the Corporation of Norfolk County, and 10 years without this coming back, I would say, is unacceptable. I don't like delays in general. I think things move fairly slow in municipal politics, but 4 to 8 weeks to get a fresh set of eyes on something like this, I think makes sense, and I would support peer review. Thank you.
I have Councilor Shelley, go ahead.
Thank you, Madam Mayor. Through you, and I think that this one would be for Mr. Burgess. Under the financial services comments, it indicates the very last paragraph of that section that further review will be required to understand how these projects were able to move forward without appropriate procurement methods and adherence to policies and so on. If that is the case, does that imply that further review will be part of the actual peer review? Or will that be sort of a separate review process that we'll have to go through? And I guess I'll just ask now, if it is a separate additional process, will there be additional cost?
Thank you for the question, Councillor. It would be a separate process, and it would be done internally by staff members. So there won't be any additional external cost. It would be internal time only. And I think the findings of that will get rolled back out to council and as part of information. It may take a while just because of our current situation, but I think in talking to Mr. Godby and Ms. Darlington, we can't guarantee that there's not going to be these other ones that come out that may have been done the same way. There was probably a way of doing business here that's gone on for a period of time. This might not be the first one, but what we'd like to do is take a look at it, make the changes that are necessary to have better reporting and put better provisions in place and ensure that they're being adhered to.
So, I guess, Councilor Martin, you just made a bit of a comment there in terms of turnover. I wouldn't blame this on turnover. I think quite the contrary, actually. That's probably the reason there was turnover. So, I know we didn't have, our last head of Public Works wasn't always in Public Works. Development Engineering, I'm assuming, does a lot of work with this as well?
Through the mayor, that is correct.
So the former head of the planning department used to run development engineering, correct?
Through the mayor, no, not that. The structure was not that the head of planning looked after
Development engineering felt under development services.
Through the mayor, I guess development services would have had nothing to do with any of this at that time.
Development engineering wouldn't have?
No, development engineering would not have.
Would development and engineering had to do with any of the other public work projects that we've seen errors on to date?
Through the mayor to
Like I could go through a list in terms of, since council's come into, since we've been elected, we found out that Port Dover was operating at a more than 50% water deficit for current capacity, despite the fact that we were told at a council meeting that everything was fine in Port Dover. Millions of dollars have gone uncollected for years in drainage accounts. Our capital budget that we were told in our first year, 3 weeks in as brand new councilors, was $14.5 million, I think. And that doesn't include, of course, this work. It doesn't include the $34 million wastewater treatment plant in Simcoe that we're told you guys have been given a heads up for several years that it was going to need to be upgraded. This year's capital budget now is $78.5 million. That doesn't include a water solution for Port Dover. It doesn't include a water solution for Simcoe. It doesn't include a water solution for Waterford, which we now know are actually potentially even more precarious than the situation in Port Dover. So 10 years ago, a company won an RFP for $90,000 to do some preliminary design work. 10 years later, we're just getting to a tender stage. So all they had to do at that point in time was win the RFP for the initial design work and then have a check to keep doing work for the next 10 years.
Through the mayor to council, I cannot confirm exactly that is how things did transpire. From my own knowledge, I do know that the RFP in 2010 was for evaluations of Waterford, Delhi, and Port Dover. Through that, the primary focus did become Delhi and Waterford upgrades, which Delhi has been completed, fully reconstructed. Waterford is in progress of being completed. We're working on new headworks now. And I believe a great part of that 10-year was downtime where they had been pulled off of Dover to focus on these other communities, which at that time had a more urgent need.
And yet here we are with another urgent need again. So you would agree with all the other items that I listed, though, that this council has dealt with in the last year?
Through the mayor to council, yes, there are a number of issues that this council has had to deal with.
Jason, I'm not blaming you as well. Like Councillor Martin said, you weren't here at the time. Neither was Jason Burgess. But I'm just trying to make a point that for when we have a report from John Mascaron claiming that there's an issue with turnover, there's a reason there was turnover. Any other questions from anyone else?
Yes, Madam Mayor?
Yep. I can't, sorry, Chris, you're frozen. Or Councillor Van Passen.
I have no doubt that these are both reputable firms and they do good work, but after 10 years, there is a tendency to get tunnel vision when you're working on a project and keep amending it and amending it. And, I don't think it's a bad idea to, like the recommendation as presented in the report, to get a peer review done, take a step back and look at it and make sure that we're offered up the right solution for these projects. I know, on my little business on the farm, if I have a problem with my corn, my fertilizer guy has a fertilizer that will fix that. And my spray guy has a spray that'll fix that. And the seed guy has a seed that'll fix it. But that doesn't necessarily make any of those the best solution to the big picture.
So it sounds like there's an appetite to move ahead with the peer review.
Like I would move the recommendation as presented, that we receive it as information, do a modified procurement on a peer review, report back to council with the findings of that review, and at the same time carry on with a review to make sure that our policies and procedures are being followed in the right way. And at that point, then deal with whether we keep the same engineering firms and to deal with the project itself. But I think that little bit of delay and in the scope of the cost of these projects, an extra $50,000 to do the peer review is probably well worth the money.
Okay, I think you've got a seconder in Councillor Martin on the other side of the table. Any further discussion on that? Going once, going twice? Okay,
Yeah.
Councillor Columbus.
Yes.
Councillor Geisens.
Yes.
Councillor Huffman.
Yes.
Councillor Van Passen.
Yes.
Councillor Rabbits.
Yes.
Councillor Martin.
Yes.
Councillor Taylor.
Yes.
Councillor Michele.
Yes.
Mayor Chop.
Yes.
Motion carries.
trying to scribble a list of some of the capital projects that went squirrely, but I lost my paper now. Next one, if I have this correctly, staff report PW 20-28, utility easement for Enbridge and Port Rowan.
Thank you, Madam Mayor, through you to council. This report is basically presenting a request to execute an agreement with Enbridge Gas for an easement over a portion of property that we own in Port Rowan. If you look at attachment number 1, it's page 203 of your agenda, you can see the map. There's an alleyway that runs from Church Street down to Wolven Street, just east of Bay Street in Port Rowan. There is a Union Gas or an old natural gas line in that area. The interesting thing here is that alleyway is actually a single parcel of land which is owned by the municipality. It is not designated as a roadway or a right-of-way or a laneway or a street, so we need an easement in order to allow Enbridge to replace their gas line which currently exists there. So essentially this is just to get them to do some work prior to us doing some of the water main work, which will be done down in Port Rowan, and just to clean up that file. So if there are any questions, I will gladly entertain them.
Any questions from Councilor Michele?
Thank you, Madam Mayor. Through you to Mr. Godby. Jason, I'm just asking about the timing of this project. I just want to absolutely ensure, because we do have another water main project going on in Port Rowan, and with both of those projects, I just want to make sure that the timing of those projects will not interfere with the business activities of the Port Rowan business community, and also with the Bayfest parade and celebrations around Labor Day. So I hope you can maybe just comment on that a little bit.
Through the mayor to Councilor Michele, with respect to this work for the gas, Enbridge has been dealing with our engineering department to try and expedite getting this report and this easement authorized in order that they could get in and get their work done ahead of us needing to get into Port Rowan and doing any work. The idea being they can do their work and then we can immediately proceed with ours. I know our project manager who's looking after the transmission main project has been in conversations with some of the businesses in Port Rowan. From a staging standpoint, they've been working on a plan to try and get the in-town works done with minimal impact and then focusing it away from, the fall tourist season and Bayfest and all of that, and focusing a lot of the efforts on the rural section. One thing I had intended on doing in the coming weeks or the next council meeting, whatever that may be, is to come back with more specific timelines on all of our construction projects that are going on this year. As you know, with the regulation changes and things that have happened now, we've had delays or perceived delays or fear of delay of some of these projects going. So we have contractors who are revising their timelines to match up. So I can bring back significantly more information on that in the future, specifically about this project for you.
Jason, thank you. That additional information would be very helpful. Thank you.
Any further questions? Okay, I have a motion that's been moved, staff recommendation by Councillor Michelle, seconded by Councillor Rabbits.
Councillor Geisens.
Yes.
Councillor Columbus.
Yes.
Councillor Huffman.
Yes.
Councillor Van Passen.
Yeah.
Councillor Rabbits.
Yes.
Councillor Martin. Councillor Taylor.
Yes.
Councillor Michelle. Mayor Chop.
Yes.
Carried.
Next report is staff report PW 20-31 waste management program update. Jason, is that you?
Thank you, Madam Mayor. Through you to council. This report, the Waste Management Programs Update, was originally started as an information memo, but then we kind of decided that it'd be a good idea to make sure that council heard all this directly and the people at home could understand what we're doing as it relates to our waste management programs. So the first item that we wanted to address was the bulky item collection program. This was approved for 2020, and we just wanted residents and council to know and understand that we do fully intend on proceeding with this program. It is currently scheduled for the month of June. The rules and regulations are highlighted here quickly, but basically you can put up to 2 cubic meters or basically a pickup truck load of household items out to the curb for collection. There will be a schedule which will be further advertised. We've been working with our communications team to get some of this information ready to make sure that residents are made fully aware that this is going on. But basically through the month of June, we will be doing all these collections. The second one we wanted to talk about was the Household Hazardous Waste Program. Normally we offer 4 of these HHW or Household Hazardous Waste Days through Norfolk County. With the current COVID-19 pandemic, we have already canceled the Simcoe event. It was scheduled for April the 25th. We are also canceling the Delhi HHW event, which was scheduled for May 23rd. That leaves us 2 events that are scheduled in the fall. One of those in September and one in October. Essentially, we'll end up with 2 events proceeding with 2 events, one on the east side of the county, one on the west side of the county. We have not finalized the exact locations at this time. Essentially, we want to do a better review and discussion with the contractor who provides this service to make sure that we're expecting more material to be brought, and we want to make sure that we've picked the best location for what we're anticipating to be an increased traffic load, as well as for the increased volume of hazardous waste materials that we're expecting to receive. Just as a side note, the HHW collection is a free service to residents. They do not pay to dispose of these things. The final thing we wanted to just quickly touch on was our waste transfer stations. That is the waste transfer station in Simcoe and the one in South Walsingham. These were closed on March 18th due to the COVID-19 pandemic. We wanted to advise council that we are working towards reopening these transfer stations. We're tentatively shooting for mid-May. It may be on slightly reduced hours. We do have those 2 sites. We've looked at various things of operating one of them 3 days a week and the other 2 days a week, or 2 days a week, 1 day a week. But essentially we need to work with our site operator contractor and ensuring that we do have staff availability in order to continue to reopen these sites. Additionally, we are working on finalizing our new operating procedures to ensure improved social distancing, as well as we are looking at only accepting debit or credit payments, whereas in the past we would sometimes accept cash. So as a final plea to our residents, I would just like to say that with the bulky item program proceeding in June, and with us looking at reopening transfer stations in May, we're hoping that people will continue to just hold on to their waste. There has been a noticeable increase in roadside dumping over the past month, which we feel could be attributed to people being home and looking to get some spring cleaning done. So I guess our plea here is that the transfer stations, we are looking to reopen them, and bulky pickup, we will come get that and dispose of it for you. So please do what you can just to safely store your waste until a time that we can dispose of it properly. If there's any questions, I'll gladly answer.
Any questions from councilors? Did you want to talk about the app a little bit?
Through the mayor to council, yes, that the app is a good, I left it in my other package in the office, the Recycling Coach app. It's there's a memo contained within your information package, which essentially Norfolk County has partnered up with this app that will, you put it on your smartphone and you can query it for disposal of various items. You know, where does it go? Should this be, is it recyclable? Is it not? It tracks, we feed the information in, so it'll track things like delays in collection service. It'll insert, and you can find out when your bulky item pickup collection is. You can use it to track the Christmas tree program and leaf and yard waste. All of our programs basically get loaded in there. It's a free app to download, and we can use that to communicate very effectively any of the changes that we make to our waste management programs.
And what's the best part of the app?
The best part of the app is that it's free.
Councilor Martin.
Thank you, Mayor Chop. I didn't pull this item for discussion because I'm slightly conflicted with encouraging the public for during COVID to go out and put themselves in a situation where they should be maybe at home instead. But on page 73 in our agenda, we received correspondence from Minister of Environment with regards to establishing second Tuesday in May as Provincial Day of Action on Litter. So while I don't want to encourage the public to go out, even though it's good to be outside and exercise, I wonder if maybe our communications team wants to somehow wrap that date into getting the app and recycling and not dumping on the roadside, and maybe plant the seed for that date for next year.
Let Matt know. He has drafted a media release already about the app to go out, but if he hasn't put it out yet, we can maybe add it in there still. Anything else? Does somebody wish to move the staff recommendation? Councilor Martin, seconded by Councilor Taylor. Okay, all those in favor? Carried. All right. Okay, so just the first one is coming off, so motion to approve the bylaws, that bylaw 2020-30, bylaw 2020-31, bylaw 2020-32 be approved, signed by the mayor and clerk, affixed with the corporate seal. It's been moved by Councillor Michelle, seconded by Councillor Taylor. Any discussion? All those in favor? Do you want to
Oh,
do
sorry,
recorded on
yeah,
them?
sorry.
Okay.
Councillor Geisens?
Yes.
Councillor Columbus?
Yeah.
Councillor Huffman?
Yes.
Councillor Van Passen?
Yes.
Councillor Rabbits? Councillor Martin? Councillor Taylor?
Yes.
Councillor Michelle?
Yes.
Mayor Chop?
Yes. Motion carried. Okay, so moving on to Councillor Martin, motions. We have a motion to reconsider being advanced by Councillor Martin. This will require a 2/3 motion to proceed.
Thank you, Mayor Chop. This motion of reconsideration comes forward after a discussion with staff. I think that they are looking for a bit more direction from council as to what we would like to do moving forward with Don John Boulevard. If council will remember, we had a deputation come forward with a petition for the removal of sidewalks, and then we were heavily lobbied by the community for the implementation of sidewalks, and possibility that not everyone had been consulted on that petition. So for staff to move forward and look for some direction, it needed to come back to council. So I might pass it over to Mr. Godby for comment.
Through the mayor to council. So yes, as Councillor Martin indicated, in October of 2019, staff were directed to remove sidewalk installation. Back on shoulder or something of that nature in lieu of a side. So essentially from a staff perspective, direction to remove the sidewalk, and the additional information that I have is essentially surrounding the sidewalk and procedurally, I'd be reconsidering this discussion, information, or am I seeking additional direction at this time, or am I just providing information? I don't know procedurally where we're at.
I can, yeah, go ahead.
So I guess the question before council is if there's a motion on the books that the sidewalks be removed. If council wants to revisit that, you need to, or debate it again, you need to pass a motion of reconsideration.
Councilor Martin, go ahead.
However, this is a massive contentious issue for the residents in that community. They're not necessarily provided with an opportunity right now for fulsome discussion on it. And I don't have any of the figures, the dollar values, or of that, any of that information of that nature in front of me right now to advocate in one way or another for a decision. Although the last time we sat around and had this discussion, we asked staff to bring forward options on a paved shoulder. So snow removal wasn't going to be disrupted, and maybe there was potentially a reflective paint put down so it was used as a bike lane and or a walk lane. But otherwise, I was under the impression I was bringing this forward so that we were able to kind of take the handcuffs off staff to bring us that information back.
So one of the options that was looked at that council had asked us to look into was the provision of a paved shoulder incorporated within the roadway between the curbs that could be plowed by the snow plow, so the residents adjoining these properties would not be responsible for snow removal. From a cost implication standpoint off the hop, our preliminary estimates of changing from a sidewalk to a paved shoulder / bike lane throughout the extent of this project are essentially a wash. The total potential savings that we're looking at for sidewalk installation are in the ballpark of around $63,000 on the scope of this project. In order to widen the road and the increased asphalt that would be required and road base for that matter is going to be in the area of around $60,000, just under. Then, in order to facilitate this, we get into the engineering challenges. Essentially, if we add a bike lane into this area, we're now widening the road, which has already been designed. So there will be a review need to be done of the grading and drainage implications of adding an extra 1.5 meters of road base, of pushing the curb line further into what would be grassed area of the road allowance. So all in all, the engineering estimates are going to be around $6,000 to $9,000 in order to complete all the required engineering updates for this in order to do something of that nature. In general, I guess, on sidewalks, this area in particular, when the question was raised about why there were sidewalks included on this portion of Don John Boulevard, essentially it is because it was identified in the Integrated Sustainable Master Plan and the Active Transportation Plan, which were adopted by council to be Norfolk County policy as it relates to sidewalks, as it relates to bike lanes, as it relates to projects that we move forward with on our water and wastewater systems. This was specifically identified as a missing link of sidewalk. If you go to the northern projection of the project limit, the sidewalk starts and carries through the rest of the Somerset subdivision over to, I believe it's the Black Creek Conservation Area walking trail on the east side of that development. So when the ISMP and the active transportation plan were completed, this was identified, and that's why it was put in the project plan. Just as a general commentary on the processes that went into the ISMP and the active transportation plan is these were long, heavily debated, and projects that required a lot of public input and went on for over the course of over a year in order through many variations and many public meetings, and there were lots of public input garnered across Norfolk County as to what was intended to be the guiding document for us for what the people of the county as a whole needed and wanted built. So from our perspective, that is why it was put in there and supported, not necessarily taken out at the request. We do have Public Information Center files from the very first PIC that was done the start of May about Don John Boulevard, where there were 3 noted objections to sidewalk installation. We have 1 noted pro for it, and since this debate came up is when some of the other residents who remained silent at that initial PIC have been coming forward with their personal opinions on whether a sidewalk should or should not exist in this area. I don't know if I covered everything of relevance for you or what you were looking for. If you have any other questions, I can try and answer that.
Councilor Martin.
Thank you, Mayor Chop. I was going to ask about the PICs. So since then, do you have overwhelming communications and correspondence from community members that are leaning in one way or another? Council's had conflicting information.
Through the chair to you, Councilor Martin. Essentially, Public Works has not heard a whole lot on this issue. I went through most of my files last night. What I have is essentially it's a 50-50 split of those who believe that it is essential in order to connect to the rest of the sidewalk network, and those who do not want a sidewalk.
And is there a change in the completion on the project one way or another? Does it push the date out one way or another substantially?
Through the mayor to Councilor Martin, as the project currently stands right now, the engineering design is on hold pending any further direction from council.
So we're not even that far yet. Okay. And then we've had conversations with regards to the Ministry of Transportation and a crosswalk over Highway 6 at the end of Don John Boulevard. Has that progressed any further? Because I think that that is an important element to, in one hand, we're advocating for no sidewalks, and then on another hand, we're advocating for a crosswalk to go across the highway for families and seniors to use.
Through the mayor to Councilor Martin, I would have to follow up specifically on that crosswalk as to where it stands. There has been conversation with staff at the MTO on it. However, in light of some other issues that have been going on, I haven't honestly paid that close attention to where that one is sitting.
I guess I would turn it over for any comments from my colleagues or the mayor. At this point in time, I'm at a loss and would prefer maybe a bit more direction or information from staff to make a decision here. I don't know if this is the appropriate time to be doing it when we're not calling on the residents to speak to it further.
I have to be honest, despite Mr. Mascaron saying how we coordinate ahead of time for our meetings, I'm actually totally confused right now as to, because we had already moved to,
And then Mr. Godby asked for it to come back because his hands were tied to bring forward additional options because we had a motion set forward for sidewalks. And we then began a conversation with him for additional options that included not sidewalks, paved shoulders and so on. And he wasn't able to bring that information to us in a formal report. So the reconsideration came forward to have this discussion.
because why?
Because they need direction from this council as to how to move forward, and a conversation evolved outside of implementation of sidewalks.
I thought we moved for no sidewalk, but we were just interested in some of the prices on the other options. And like you said, it was the issue with between the driveways and stuff, that there might not be enough for a bike lane because it wasn't going to be wide. I can't even remember myself.
Yeah, through the mayor to council. The way we ended up here tonight on this is that Public Works was told not to install a sidewalk.
Right.
And then there was a certain level of the public that were then questioning the fact that council had made that decision. And in order to even continue to talk about potential of leaving the sidewalk in, reconsideration was required so that we could have this chat. You are correct.
So some constituents didn't follow the council agenda, and then after the fact complained about the night that we specifically held this, and we listened to a bunch of people make deputations on it, and now we're going to go back and you're wanting a council member to bring back a reconsideration on it to talk about leaving the sidewalks back in. This is why we have jobs that last 13 years. I thought we were just getting a quote and some estimates, or whether or not it was even possible to do a bike lane down the side. That was the direction from council. I've been totally confused of what's even going on here.
Yes.
So I'm interested still in the quotes, like the
Yeah.
original motion on what it would take to leave the bike lane. Is that, Councillor Martin, what you're thinking too?
To be honest, I have no idea what the preferred best solution is in this situation. I think the additional confusion comes from claims from the public that the petition that was brought forward to this council wasn't done fulsomely. It wasn't done appropriately, and there were names on that petition that those individuals didn't contribute to. And so there was not a second opportunity for the rest of the public to come forward and speak on it if they didn't attend the PIC meeting.
If I could, Madam Mayor,
Go ahead, Councillor Van Pass.
and I got to apologize. A lot of what we're hearing, or what I'm hearing from staff, is it fades in and out, or it skips out. And so if I'm repeating anything that Mr. Godby said, excuse me. I think we need a motion of reconsideration to allow staff to bring us a report on the different costs. Because if you're doing, and staff can correct me if I'm wrong, if you're doing the road with a sidewalk, that sort of is the integral part of the drainage system, and it's designed differently, and the drainage works are different than if you're putting in a bike lane and ditching and that. And I'd like to see the options on a cost basis on the design, whatever different ways they want to bring to us. And at some point, we should also have the discussion, because I need some help on this, because the number of sidewalks that are in Ward 4, I'm not even really sure where they are and what they're for, but are sidewalks put in place particularly for the adjacent landowners, or are they for the community as a whole so that people can conveniently get from one end of town to the other end of town? And that's the bigger discussion that needs to take place. And but I do believe we need the motion to reconsider, to sort of untie the hands of staff, let them bring us a report on all possible options, and let us decide on it and make a decision and move on it from there.
We did speak about staff bringing back a report in the future, I recall, on sidewalks and the fact that there were so many sidewalks that were being put in areas that maybe, you know, didn't need them as much as other areas that had a much higher need around schools and so on and so forth. There didn't seem to be a lot of logic to some of the choices that had been made. So I do recall that we had asked for that direction at the time. I don't understand why we need a motion for reconsideration when they should have already had the estimates for the job with the sidewalks. So that part arguably was already done because they were moving ahead with it. And then they were going to bring ahead the other options. Now, if once you see all the options, you still want to reconsider it and have no sidewalks, or have sidewalks now, why it couldn't be done at the time, I don't understand.
Well, I think if this subdivision would be built today, it would have sidewalks, the developer would put them in, all of those things. The reason we're working on the road is because it is so old that the infrastructure underneath is what needs fixing, and we're going to do the rest of it at the same time. But I believe if this was a new subdivision going in, there'd be no question about whether or not the sidewalk would become part of it. It's not one of those little corners in the back of nowhere that doesn't really need them.
Well, actually, until this council came in and said that they were going to not, that developers were going to be required to put sidewalks in, I think they were waived quite often by previous council.
Yeah.
So.
I think this area is about, 40, 50 years before that, so.
I still don't agree that we need a motion for reconsideration today, why we can't still have the report come to council that was originally asked for.
If it assists Mayor and Council, I think one of the reasons why reconsideration was just suggested was because we've got a resolution of council saying that sidewalks shall not be installed. So staff don't want to be disrespectful of a council decision and present that as a potential option going forward. So staff could definitely present the cost of the bike lanes and the paved shoulders. That's the direction that they've got. But to do a comparison of that to something that council's already eliminated as an option would be kind of somewhat disrespectful to council's current direction.
And I don't feel disrespected because it was already something that was worked on. So they should have already had those numbers. And so I would just assume you would be comparing it to the sidewalks. That was what we talked about at the time. So can we just assume then that we're going to get the report that was originally asked for?
Through the mayor to council, I can bring back a report further detailing other options with the sidewalk ruled out, as that is the direction that we currently have.
But you can use the sidewalk as the basis of comparison. Here's what it was going to be, and you're going to save X amount if you move to this, or it's going to cost you this much more if you move to that.
Through the mayor to council, that is correct. I also believe that part of the reason for the request for reconsideration was to allow those other residents who felt that their voice was not heard and was not reflective of that petition in October, in order to have an opportunity to speak to their opinion on the sidewalk. Without the reconsideration, it is my understanding that the council decision is there will be no sidewalk in that section of Don John, and therefore it cannot be discussed any further.
My problem is this opens up a whole can of worms in the future with all kinds of decisions that we make when they come forward. They knew it was in the council agenda. They had an opportunity to come and speak to it. If once we see the results from Public Works, it looks like we might consider doing a sidewalk again, if the costs are not that much different or so on, then why can't we have a motion for reconsideration? Then notice will be provided to the public, because we'll have to provide 2 weeks of notice for the reconsideration, and they can show up at that time.
Through the chair to council, I can have a report here next meeting.
Councilor Martin, does that work for you? Councilor Van Passen, does that work for you?
Or the other option is that I can second the motion and put it on the floor. If we get a 2/3 majority, then it goes one way, and if we don't, it goes the other way, so.
But if it
Doesn't
goes the
really-
other way, then you might not get the information you wanted.
Well, having a preconception of what information you want when you don't know what you want, sort of defeats the purpose. Would like to see all the options on one sheet of paper to say, here's how much it costs to do it one way, because it's not like you just add something to it. And again, maybe staff can correct me if I'm wrong, but if you're designing it to be built with sidewalks, gutters, drains, it's a totally different job. It's not like you do everything the same and then just pour 4 feet of cement on each side. There's a difference to how you go about the entire project. And I'd like to see the side-by-side comparison of the two at the same time, not just say, well, a year ago we looked at it one way and now we're looking at it another way, and here's a bushel of apples and here's a bushel of oranges, and let's see which one I like now.
Through the mayor to council, Councilor Van Passen does raise a good point. The one thing that I will point out is that we can only speak in very approximate terms and generalities relating to the engineering design unless we are willing to pay to have the actual engineering completed for each of these various options, being bike lanes on one side or 2 sides, being bike lanes with sidewalks or no sidewalks, being no bike lanes and just curb and gutter. Where do you put the parking? Is there parking on one side? Do we now lose on-street parking because of bike lanes? There's all these different variables that can go through, and the level of effort and detail, I guess, is what I would be looking for some sort of direction on. How much engineering design are we going to put on this, recognizing that that it's going to come at a cost in order for this work to be done.
How many citizens came forward to say that they didn't feel that they were heard when there was ample notice provided?
Through the mayor to council, I have at least 2 that I was contacted directly by. I'd have to look in the other file as to what other members of council may have sent me anything that they would have received. I don't keep track of all of those, and I had.
Yeah, but we're not 2, not 200.
Yes, that's correct.
Councilor Shelley?
Thank you, Madam Mayor. I was just checking my notes about that day we originally discussed all of this, and I had recorded that there were 3 such people.
Councilor Hoffman, sorry, I didn't see your hand there. Go ahead.
Okay, sorry. Thank you, Mayor Chop. Through you to this current discussion, I completely agree with you, Mayor Chop. This issue has been brought forward. It was given due diligence. It was given notification. A decision was made by council. I unfortunately wasn't around when this decision was made. But to me, you're right. If we do things like this, when we look 6 months down the road and going back and changing things, we'll never get jobs done. And that's where things get more expensive, because now this was something in October. Now we're in April and we're still looking to get things moving. So I think this is a dead issue and we need to move on.
Thanks, Councilor Hoffman. Councilor Martin?
Thank you, Mayor Chop. I don't disagree with that in the least, and I don't have a preference for how the job gets done and when it gets done and what direction. The problem is that we're at a standstill here, because I don't think that, from what I'm hearing, we're going to get the information as a comparable. So I think that's why the decision needs to be made so we can at least get all of the facts in front of us.
There's a big difference to using something as a comparable in a report and asking for a motion for reconsideration because 2 citizens emailed our head of public works and said that they weren't heard. I don't mind if when you bring the options that we had asked for way back when, we did ask for what would a bike lane look like, what would the extra cost be, and when we said extra, or what would the savings be, clearly the sidewalks were the baseline because that's what we were going to look at. So I am not comfortable with moving for a reconsideration because 2 people emailed the head of public works, but I certainly don't mind providing some direction to use the sidewalks as the baseline for the discussion of bike lane or no bike lane.
Okay. Yeah.
Okay.
Anyone else? Okay, moving on. Councilor Martin?
I would just like to add, I don't think that it is fair representation to say it's 2 people, but none of us have that information in front of us right now to make that decision.
But you're telling me that you were approached and asked to put this motion on the floor by staff?
Yes.
Okay.
But I have heard from more than 2 people that live on that street. That I don't think that's fair representation of the issue, which is why I also am struggling with doing this without having the information, but 2, having the dialogue with the community, because it didn't happen the first time around. Whether we want to be here or not, it didn't happen the first time around.
So we could get the baseline, and then if we decide we wanted to change something at that point in time, when we get the report we asked for, we could always go look at it then. Okay. No notices of motion, general announcements. Before we go to general announcements, there's a couple of information memos that were distributed. Jason, did you want to talk about any of those? Do you want me to? It's up to you.
Sure, I'll be very brief looking at the clock. The first one was with regards to our customer service improvements. I will take no credit for this. This was an initiative started by the mayor's office and Megan Steinhoff. Like any good bureaucracy, why have one number when you can have 8 numbers to call when you have an issue? So what we did was during the early days of COVID, we were noticing some significant issues when counselors were calling in with issues or complaints, how many people that had to get triaged to. So staff, including Shelley Darlington, will be launching a new phone number and a new email address that all your COVID complaints can go to one source, get triaged properly, and get a response back. Because with these issues, there's usually a multifaceted number of departments that need to respond to it. Public health, could be community service, and that kind of stuff. So they've worked really hard to put in one number and one email address for COVID complaints and questions we'll go to. That will be being launched tomorrow. So you'll see some meeting on that. So we'll direct council to hand out that number or that email if there's questions or concerns. The other information memorandum, I know there was always concern about delegated authority of the CAO, and this is part of the reporting that goes to it. There's 22 uses of the delegated authority. To be clear, there was really one decision impacted 20 of those. Because we've closed our buildings to take in tenders and stuff, we used a different approach. It's an electronic approach, so that covers off 20 of them. There was one proposal to lease land that we have to a farmer that has been farming it for years, and the other one was to buy some cars that were approved under the budget because our mileage for bylaw officers are going through the roof during COVID, so we wanted to move quickly on that. So those are the two information memorandums.
I personally love the one phone number. It's always a challenge remembering multiple, but one I can remember to hand off to people when they're asking. Any other questions from councilors? The other motion, it wasn't in the agenda that we needed to add, is that Jason Burgess be appointed as a municipal law enforcement officer for Norfolk County, effective immediately. So if I could have a mover, Councillor Martin, seconded by Councillor Taylor. Any discussion on that? All those in favor? Oh, sorry, did you want to record that? to work.
All right, Councillor Geisens.
Yes.
Councillor Columbus.
Yes.
Councillor Huffman.
Yes.
Councillor Van Passen.
Yes.
Councillor Rabbits.
Yes.
Councillor Martin.
Yes.
Councillor Taylor.
Yes.
Councillor Michele.
Yes.
Mayor Chop.
Yes.
Unanimous. Thank you.
I had one, thank you, and through you. And I am plagiarizing some of this from Trevor Meisner of Manager Organizational Health and Wellness. I could stop. Okay. So again, Trevor Meisner, Manager Organizational Health and Wellness Programs with Norfolk County. I sent out an email recently acknowledging that today is April 28th and is designated as the National Day of Mourning. This day started in Canada and is now recognized by over 100 countries throughout the world. This is a day where we are to recognize those that have lost their lives or have been injured in the workplace. In these very difficult times, please take a moment to think about all those individuals that have been affected by a workplace accident. An interesting quote that was provided by Trevor. In 2018, there were over 250,000 Canadians injured while at work. Over 1,000 of those Canadians had lost their lives due to a workplace accident or illness. Today is a day where we take a moment to think about those workers. I would encourage everyone to think in your own workplaces and those in your family and the places that they work. Challenge yourself to think about what you could do to make your workplace a safer place, not only for you, but for your colleagues. And that actually leads to the mask that is on my face today. It's something that I provided myself. It's not an N95 mask, it's just a dust mask. But this mask doesn't actually protect me from the COVID-19 virus. It protects you from my water droplets. And I'm sitting in Councillor Geissen's seat here, and I'm cognizant of that as I put on my hand sanitizer and I wear this mask. Think about the small things that you could do to make your workplace just that much safer for yourself and for your coworkers on today, the National Day of Mourning. Thank you.
Thank you, Councillor Rabbits. Anyone else? Anyone? Councillor Michele?
Thank you, Madam Mayor. I'm not exactly sure if this portion of our agenda is the appropriate place for me to put this, but I don't know where else to put it. So I just would like to ask our CIO if you might comment on a possible suggestion, since everybody is, as Councillor Rabbits has just mentioned, observing all of these protocols for COVID-19, staying home, washing their hands, washing their clothes, and using perhaps an inordinate amount of water, as that more than they usually would, if we might be able to consider possibly lowering or helping with some water rates for residents.
Through the chair to the councillor, I know looking for water reductions has come up in some emails. The challenge with water is the total cost of water is put to the users, so the total cost will always be there. So if it costs $100 million to run the water system, then the people who use it have to pay the $100 million. If you try to make any changes to the rate, you either end up with a deficit, which will get added to next year's bills, or you end up, we can't even put it off to the taxpayer. You're not allowed to subsidize water rate from the taxpayer, so there's no option on the cost. Ironically, the more water you use, your actual cost per liter actually decreases. So your unit rate actually goes down because you're taking that cost and spreading it out over more water usage. So unfortunately, the cost just gets allocated to the users and there's nothing we can do. Or if we run a deficit, it gets run into next year's budget, so you just end up paying for it next year.
Thank you.
Anyone else for any general announcements? Councillor Columbus.
Yes, I wonder, this is to Mr. Burgess, wonder if we can get a report sometime, a status report on the Moose Harbor water supply and also the Waterford EMS situation there. I know we've hired 4 more paramedics, so we certainly have full complement 24/7, I believe. Just wondered where that particular project is at in Waterford and the one in Port Moose Harbor.
Through the chair, just want to confirm, so it was an update on the EMS hirings for Waterford?
On the facility in Waterford itself.
The facility, okay.
That's correct.
I'll do that.
For years, we've been speaking about putting an addition on there, and I haven't heard anything of late. And I would imagine that some of the workers there are getting anxious to find out what's happening.
Any other questions? Or general, go ahead, Jason.
Through the mayor to council, I just wanted to take a quick moment to draw your attention to your information package, page 94. There is a memo there just with reference to public consultations that Norfolk County is going to be essentially with COVID-19 pandemic and us not allowed to have mass gatherings and such. It's made it very difficult for us to proceed through some of our engineering planning design processes, particularly as it relates to the municipal class EAs that can be required. So essentially we're working kind of on a project by project basis with our communications team and with the consultants for our various projects to look at a way that we can better engage the public through online or virtual means. Right now, this may include the establishment of some project-specific web pages that would be hosted on our Norfolk County website, using more online surveys as opposed to expecting people to come to, say, a public information center and filling out a paper survey in person. More direct mailings to their homes. We've had suggestions for certain projects that consulting teams could put together a recorded presentation that could be shared with the public or posted on a website, as well as an increased opportunities for some virtual question and answer sessions. So we just wanted to kind of highlight that to council that despite some of the physical restrictions that may be getting placed on our abilities to engage the public and seek their input for projects, we are working very closely with our communications team in order to try and find alternative means where we can solicit this information. Related to getting information out, I just wanted to quickly touch on some of our ongoing construction and what's currently in progress across Norfolk County. King Street reconstruction in Delhi resumed near the start of March. It's currently ongoing. That is currently really our only active project at this time. However, notices will be getting mailed or have been mailed for some of these other projects. Summit Circle, that we're doing some storm sewer installations, Summit Circle in Simcoe. It's scheduled to begin on May 6th. College Ave West, or College Ave in Waterford, that project which was in progress last year in that northwest quadrant of Waterford, they're looking to start back up again effective May 4th, which is Monday. Chrysler and Maple reconstructions in Delhi, we're projecting starting in mid to late May. Our urban asphalt program, where we basically are doing shave and pave jobs, that is projecting right now to be starting after July 1st. And just in general, we've been working with our contractors to get going on a lot of these critical infrastructure projects that we have. And it's kind of looking like it's that mid to late May we'll see an increase in the number of projects that start. And essentially, I alluded to it earlier that I would bring back a more fulsome report as Councillor Michelli had requested as to some of the stage timings that we have of these projects now that we know that contractors are available. They've been able to secure the proper supplies. They have COVID-19 contingency plans in place for the safety of their workers, just so that as all of these pieces are slowly falling together, we'll be reporting back just to let you know where we're at with the startup of our 2020 construction season.
Thanks, Jason. Councilor Shelley, go ahead.
Madam Mayor, I'm just wondering if I could, while Jason, you're speaking about these construction updates, if it's possible for you to just briefly, if it's possible at all, update us on the Causeway Bridge project.
Through the mayor to council. The Long Point Causeway project, they're still working on some engineering design. The archaeological work I know is not set to resume, mainly because of it's not deemed essential work at this point. However, like I said, the other engineering work is continuing on. We do have full support for whatever activities that Parsons can complete. They have our support that we do deem this to be a critical infrastructure project. For anyone in the area who's traveled over the bridge anytime recently, we know that there's some wood decking that is starting to look a little beat up. We actually have a contractor set to go and get some replacement boards put in there. So the idea is that we'll do this temporary patch on that bridge in order to continue to get us through the 2020 year until we can actually get the construction started and that bridge replaced.
Thank you, Jason.
Anyone else? Okay, there's just the last closed session report. I'm assuming everybody's read it. Is there any need to go into closed session? Or can we just move the recommendation in open session? Anyone? Councilor Shelley?
Thank you, Madam Mayor. If it's okay, I'm going to check with the clerk to see if we're allowed to do that.
We're allowed. Unless you need to debate something that you feel is, okay. So in that case, I'm going to read the recommendation as printed. That report FS 20-17 changes to service delivery at the transfer stations be received, and that cash no longer be accepted at Norfolk County's transfer stations, effective immediately, and further that this change be included into corporate communications to the residents of Norfolk County. Mover and a seconder. Councillor Martin, seconded by Councillor Rabbits. Any further discussion on that? All those in favor? Oh, sorry, I guess that should be Andy. Ugh.
We're all geared up for that. I was going to let that one slide. All right, Councillor Geisitz. Councillor Geisitz?
Yes.
Yes. Councillor Columbus?
Yes.
Councillor Huffman?
Yes.
Councillor Van Passen?
Yes.
Councillor Rabbits? Yes. Councillor Martin?
Yes.
Councillor Taylor?
Yes.
Councillor Michelli?
Yes.
And Mayor Chop?
Yes.
Unanimous.
Okay, motion moved by Councillor Michelli, seconded by Councillor Martin, that bylaw 2020-33 being a bylaw to confirm the proceedings of the Council of Norfolk County at this council meeting held on the 28th day of April 2020 be approved, signed by the mayor and clerk, and affixed with the corporate seal. All those in favor? Carried. And finally, that council be adjourned at 7:38 p.m., moved by Councillor Michelli, seconded by Councillor Martin. All those in favor? I like how Chris's hand's still frozen on the screen. It's carried. Thanks, everyone. Have a good night.
Okay.
Erie Beach is caroling